All right, good morning, everyone. We are minus a gavel, so I'm going to use my voice and call this meeting of the Early Learning Council to order. Thanks to everyone for being here. We're going to start with just a few housekeeping announcements and pieces of business while folks are getting settled. We are live online, and a reminder to council members that the mics are all live and they're equally live, and there's not a way to turn them off. So anything that you say, even in a side conversation, gets broadcast. So just a fair warning to everyone. And I think we have a couple of council members joining us by phone, but the room, the placement of the phone is a little awkward. So we're going to try and see if this works. Let me just check to see. Eva, are you there?
Yes, I was on mute from here.
Oh, great. Thanks. Can you hear okay?
A little bit. I have to switch phones in a minute, and then I'll probably hear better.
Okay, great. Thank you. And I also think we have Lynn Saxton on the phone. Are you there, Lynn?
Yes, I am.
Great. And how's the sound for you?
Perfect. Thank you.
Great. And is Charles on as well? Okay. Any other council member on by phone? Okay, great. Just a couple of other items of housekeeping. I'm going to turn it over to Seth for some instructions to the council for travel reimbursement issues, and then we're going to go ahead and get started. We'll start with an agenda review and some introductions. So, Seth.
Chair Curtis, members of the council. For the record, my name is Seth Allen. I'm the administrator for ELC. You'll see a purple folder in front of you. We are trying right now to streamline the reimbursement process.
Did you note that this is Linfield College fellow?
I did not.
Also the Huskies, unfortunately.
Inside you'll see a process. It's a draft process, so if you see anything here that you think won't work, or if you have other suggestions, please send them along. Inside the packet you will see a parking pass, first of all, for Salem. We do have some upcoming meetings, so please use that. I'll get more of them. I didn't have enough for multiples inside that folder. Inside you'll see a authorization for private vehicle. So if you're using a private vehicle, which I am assuming almost all of you are, we need this and a signature on this. Then also stapled to that is the reimbursement expense form. Those of you that have been turning them in, I've been kind of telling you certain ways to do it, but it's pretty self-explanatory. The only thing that people are missing might be that you're putting your tax for your hotel. You want to put it on the bottom piece here, and then the regular price up here. And I need receipts. So what we're going to try and do for the future is I'll always have these filled out with your name and hopefully the right mailing address at the meetings. If you could fill them out and then give them to me by the end of the meeting or before we leave, that would be great. Our goal is to get you a check within 2 weeks, your reimbursement check, okay? If you can't do that, go ahead and send it. There's an address to send it to Alyssa in our office here, and we'll make sure that gets done. Any receipts, please attach that you've used throughout the trip, and your hotel receipt also. There's a mileage chart in here, just in case, for quick reference. Don't put it down. Also, if you just want to put, where you're coming from, we can usually fill in those numbers. We can do that. Now, were there any questions about that? And if there are, and like I said, if there is something that you think should be in here or missing, or a suggestion or something you don't like, please let us know. This is a work in progress. Okay.
So thank you very much. This will be really helpful to streamline, and really appreciate it. Great. All right, well, welcome everybody. Thank you so much for joining us. A couple of announcements for everyone. There are materials for those of you that are not council members out on the table as you entered. There's also a sign-in sheet. Please do sign in so that we can ensure that you are on our list for notification. And then there's also an opportunity on that sheet to indicate whether you want to be part of public testimony, which we'll do at the end of the meeting. And so I'll try to remember a couple of times throughout the day to just remind folks to sign up, and at some point, toward the end of the meeting, there'll be a last call for those of you. And then what we'll do is we'll divide the amount of time we have by the number of people who want to provide public testimony. So, all right, do we have a council member join us by phone?
And that was just me switching phones.
Oh, all right, thanks, Eva.
Thank you.
All right, so we're going to go ahead and get started. We'd like to do introductions just to get a sense of who's here in the room with us. And so what we've been doing is just sort of giving out the same categories of types of folks who might be in the room. And if you could just raise your hand, I think it'll be helpful for us to get a sense of who's here participating in the room. So if you are here representing a local nonprofit organization that serves children and families, would you raise your hand? If you are here representing a county or other public agency serving kids, raise your hand. How about state employees? If you're a state employee, would you raise your hand? Great, thank you. I know we have at least one federal partner in the room. Any more? Okay, good. I accidentally missed that at one meeting, so sorry. All right, school district. Who do we have representing schools? Great, thank you. Anybody from the medical community? Okay, who did I miss? What sort of categories? Parents? We're all a lot of. All right, what did I miss? I'm sorry.
Higher education.
Higher ed, thank you. Others that I may have missed? All right, well, thank you so much for being here. We really appreciate it. Let's have council members introduce themselves. We'll go first with those that are here in person, and then we'll go to those who are participating by phone. So let's start down at this end with Vicki.
Hi, I'm Vicki Bishop from the Confederated Tribes of Grand Island, and I'm the Early Childhood Education Program Manager.
I'm Jim Terry. I'm the Executive Director of Community Action Team, a private nonprofit on the North Coast.
Hi, I'm Dana Harganani. I'm a pediatrician and I serve as the Child Health Director for the Oregon Health Authority.
I'm Jada Rupley. I'm the Oregon Director of the Early Learning System. I'm going to have to learn how to say that, working for Governor Kitzhaber and the Council.
Thanks. Hi, good morning, everybody. Pam Curtis, Chair of the Council and Director at the Center for Evidence-Based Policy at OHSU in Portland.
Terry Tolliver, Director of North Central Public Health District serving Wasco, Sherman, and Gillum counties.
Nick with Now, business person from Salem, Oregon.
Marlene Yeskin, attorney from Medford, and I also sit on the Medford School Board.
Bobby Barber from Oregon State University.
Kim Williams, North Central ESD Early Education. I'm the program director where we serve Gillum, Wheeler, and Sherman County, Head Start, and Food Start.
Janet Lori Smith, I was the director of Early Childhood Services for Clackamas County for a long time, and retired now.
Great, thank you, everybody. And on the phone, Eva, would you introduce yourself?
Eva Rosenthal, Oregon Athlete, number 45.
Great, thank you. And Lynn?
Lynn Saxton, Executive Director, Youth Villages, Oregon.
And do we have any other council members who joined us by phone? All right, thank you very much. So a couple of notes about the agenda today. We're going to start with a presentation in just a few moments from some of our community partners that we visited with yesterday. Before we do that, I'm going to offer the council members a moment to just reflect on the incredible afternoon that we spent with some of you yesterday. We then are going to have a conversation about the timeline for the charges that we have in front of us due to legislation and other pieces. And council members, we will start, I emphasize the word start, the conversation today about the outcomes and the metrics that are associated with those tasks, so that as we put together our work plan, we are clear about what we're striving for. And we're going to be talking about those in terms of system outcomes, service outcomes, child and family outcomes, and then outcomes for this council itself. So that's the outcomes and metrics piece. We have a report from our executive committee. We have a report from our home visiting folks. We have a report from our hub committee. Krista's going to be doing that. Charles was not able to be with us today. We also have a report, a potential charter, which we'll need you to approve or adjust to actually officially kick off the long-awaited joint Committee with the Oregon Health Policy Board. And I'll just make a note there, and we're anticipating Dr. McKelvey joining us for that presentation. She has a short window in which to be here, and so we'll take a pause if she's able to join us and deal with that item of the agenda when she arrives. We have a staff report from our director, and then we have a couple of work group updates as well. We plan a working lunch, and as I mentioned earlier, we'll end with public testimony. So if you want to provide public testimony or input to the council, please do indicate on the table.
Chairman Curtis, the work group updates are in the packets, and so we probably will just respond to questions in the interest of time if we get them.
Great, thank you very much. Okay. Anything else, council members, that we need to have on the agenda that's not reflected here, or any other adjustments? Okay. With that, just thanks again to the fabulous folks that we visited with yesterday. We saw some really interesting programs, had some really good conversation, and thanks to Barbara for organizing all of that. I wanted to just take a moment and have council members reflect on that experience. And if there are things that stuck with you that you want to bring forward that we can note for our work going forward. Anything that struck you so far?
I'd like to say it was an affirmation of the wonderful work that's being done throughout the state. I think that those in the trenches, those that work hard, aren't always acknowledged. You are in your own little work, struggling to make good things happen for kids, and it's just amazing to me the effort and energy and the strength and goodwill that you put forth, and that it's everywhere. You want to know. So thank you.
I had a similar reaction to one I had before about how collaborative our work is, and how effectively you work together in this new collaboration on nurturing communities is an example, but we heard all kinds of examples of where you were doing things as a team rather than. So.
If I could piggyback on collaboration, though, part of that collaboration, I echo what you said, but also collaboration of the total community, where, you know, the faith community, the business community, particularly the business community, on showing the value of what you're doing. There's a term called behavioral economics, which is a return on investment on what you're doing upstream. It affects whether it's Oregon Youth Authority, Department of Corrections, or whether it affects the graduation rate, whether it affects the whole community itself, make it a better livable community. In our community, we have to hire 125 doctors, and when they Google our community, what are they going to see? So this is resonates with the business community for what you're doing, that they want to be engaged in, because it makes the community much more viable to be able to recruit good people, and also the livability of your own community. So collaboration amongst yourselves, I echo what Bobby just said, but also you want collaboration A through Z, not through A through M. I'll get off my soapbox, but you need to engage the whole business community in itself, because they have a vested interest in your success. You need to play upon that, and don't be siloed.
Thank you. Were there thoughts down here?
I just wanted to add how thankful I was to have the opportunity to meet with some of the families that are being served here yesterday, both for the courage that they showed in participating in your programs and joining us yesterday. And I think what struck me was not only the significant challenges that they face that all of you are working to serve, but also the resiliency that they have. And if we as a council can continue to think about how to build on those resiliency factors, not always be thinking about risk, but how do we build that resiliency, I think would be really helpful to us.
Other thoughts?
I want to echo what Nick and Bobby said about the collaborative nature of the rural community we've seen, and that's been great. The other thing I wanted to say was that I appreciated the conversation last night about the hubs. As a member of this hub subcommittee, I appreciated the format of fears and hopes, and I appreciate people being very frank about that in our meetings.
I was really impressed by the leadership, the local leadership, just how positive everybody is, and how they're viewing these changes as a move forward instead of backwards. And I'm really thankful for the leadership in this community.
Pam? I jokingly said I'm waiting for us to visit some place that wants to be sucked up by the iPad 4. We hear that all over every place we've been, and I think being in the communities really allows people to see geographically the differences. And so on a map, it looks like from here to Roseburg to Medford is a straight shot, but usually it isn't. And also, I would say working in Clackamas County, which is the Tri-County kind of bigger, but it's not on I-5 exactly. And people in Clackamas County didn't want to be sucked up by Portland. And I guess part of that is I hope that somehow we can come to appreciate the differences in our communities and see Oregon children as a responsibility for all of us, and not that we in Washington County have to protect our kids from Multnomah County, or in Ontario protect from Coos Bay. And, somehow we have to become responsible for all our children, and that's going to take some prying of fingers on all of our parts, but that would be a goal for me for our council.
Great, thank you very much. I'm going to note that and put it on the flip chart in just a moment. Was there someone down here? Was it? I'm sorry.
No, I just wanted to make one final comment in terms of this is my second council meeting, and we're on a listening mode. And one of the things that I took away from this community forum, as well as the very first one, is first of all, like folks said, is you're doing things well. But the second is, as we recreate this system and look at how we can do efficiencies, that some of those efficiencies need to touch you in a way that we are not monitoring every funding source that you have in 5 different ways, and that the state is very, very understanding and how we look at that being part of the success, so that we can keep those services directed to kids and families. And we want you to know that long before I got here, this council was committed to that, and I think that our governor is committed to that. So whatever that takes, both at the state level as well as looking nationally, that we want to make sure that somehow that is minimized while the service levels are maximized.
Great. And I had a reaction that sort of echoed some of what folks have already said, but a little bit different. And I appreciate the collaborative nature. We talked a little bit at my table last night about how sort of resources are a double-edged sword, right? And when you have them, it's easy for people to argue about who gets them. And in some ways, the absence of money resources creates this ingenious collaborative spirit. So that was very evident to me, and I, like Dana, really appreciated the opportunity to talk with the families that we saw yesterday. That just, it puts a different lens on it. That is the lens we all ought to have at some point in looking through all this. So thank you for including those folks in our meetings and conversations yesterday. And then I left the conversation at the community forum last night wanting you to not wait for us. You've got so much going on, and I heard some language about when it gets configured, or what is it going to look like. And you've got so much going for you. I want you to build on your own resiliencies and your own strength, and not wait for us, because it's going to take us a while to churn through the bureaucracy and the system. And I think we learn from you more than the other way around. Anything else?
As we've traveled around, there are really common themes about what communities are doing. Everybody's working on parenting, and everybody's working on those highest risk families. But what was reinforced for me again yesterday is it's different because locals know their communities best, and they know the approach to take in their specific community. And while the themes are common, the way it's implemented and the resources that are pulled together is different in every community. Thank you.
All right, we're going to go ahead and move on. Thank you all very much. And we have a presentation about the Coos and Curry partnership. So if we could have Barbara and
Tennille's not here. Cam is going to be
all right.
sitting for Tennille.
Great. Well, come on up, and look forward to hearing from you. And council members who are on the phone, we have a PowerPoint presentation in front of us, and we will be sure to get you copies of that.
Well, first of all, please let me welcome you on behalf of Coos County and our Board of Commission and everyone from our county, how much we appreciate what you do for us on a daily basis. We arrange for sunshine for you.
We really appreciate
The
it.
weather's easy, finances are hard. So, but what you're doing is so dramatically important to all of us, and I can't tell you how much we appreciate it. Because Barbara and I were talking earlier this morning about how the work you're doing today and each day affects generations. We were talking about how kids that we worked with 30 years ago are now introducing us to their kids. And you've got a wonderful pay-it-forward ripple effect that's going to be felt 50 years from now just as strongly as it is today. And change is difficult to go through. We all know that. I mean, we're a kind of a ranching and farming and fishing community largely. So we kind of view things a little bit differently sometimes than the cities. But there was a woman, a farmer's wife, who was sitting with an insurance agent, and he was out there because their barn had burned down, and she was expecting a check, and he said, "Oh no, ma'am, we're going to build you exactly the same barn." She said, "We're not going to get paid, so we can." No. You have a replacement policy. You get exactly what you had before. She said, "Are all our policies like that?" And he said, "You bet." And she said, "Cancel the one on my husband." So you see, there are times when change can be appreciated. And we have different ways of looking at things in the cities and even right here. And I got a kick out of what Janet said, because I grew up on the river. And when you grew up on the river, the mothers in the cities didn't want their daughters to date the wild boys on the river. But I married one of those girls in the city, and it turned out okay. And so, see, sometimes really difficult financial situations force and bring out the best in all of us. And the positive energy that I've seen around this is dramatic. I mean, you guys are people here that are working on the ground that see this every day, because we deal with a high poverty level. We deal with large unemployment. We have a different economic basis, and it hits us hard. And so how we present this, how we bring this change about, it's wonderful partnerships where a lot of this is going to be reflected in how we present it and how we move forward with those families. Barbara and I and our groups have been talking about, outdoors, fishing, hunting. That's what we have here. That's a common denominator with our families. It's a way we can reach kids. It's a way we can reach parents. And so as much as we have in common, we're all a little bit different. And it's so wonderful that you realize that it can't be cookie cutter change. We share a common desire for a better future for all of our kids, but we're going to present that differently on every level. So once again, thank you from all of us for everything you're doing. I can't tell you how much it's appreciated, because it's our future. It's the state of Oregon's future. And I'm going to turn you over to our crew, who I'm very proud of. Barbara.
Good morning. I'm Barbara Bassett, and I'm the Director and Prevention Coordinator for the Coos County Commission on Children and Families. And I was tasked by my Commissioner Liaison, Cam, about 13 months ago to convene our early learning and childhood partners from Coos and Curry County. We also invited folks from Douglas County to begin the conversation about what House Bill 4165 is going to bring to our communities and how we could head it off at the pass and really get a jump start on what we are doing and how we could move it forward. At this time, I'd like to introduce Myrna Barber, who is my counterpart.
Thank you. I'd just like to comment that Coos and Curry have worked very hard together over the years, not just on this project, but on many, many projects. And I think if you see our acronym, you'll see it's a CCTPT. And the reason it's CC is that we've hassled each other over the years. Well, is it Coos Curry? Is it Curry Coos? What comes first? So we've got it figured out so we can do it either way we want to, whenever we want to. And we've got a good balance going here with our partnerships in many areas, including things like parenting and home visiting, etc. And we also have all of this sage old advice here that's been around for a long time, and all this youthful enthusiasm, who is technological wizard. And she has done the lion's share of the work in putting together the PowerPoint that we're going to see this morning. So I'm going to turn it back over to her, because she knows every word that's in there.
First, I'd like to start our presentation by asking every one of our CC Transition Planning Team members that are here today to stand up. If you have been involved, even limited, please stand up. First of all, I want to thank you publicly for your time, your energy, your enthusiasm, your realism, and your passion. We are making a difference. For the past 13 months, we have been meeting monthly and/or corresponding via email to review, digest, and develop a common vision for our transformation to the early learning system charged by passage of House Bill 4165. At the end of our presentation, questions from the Council may be directed to a TPT member for a short response. We have been walking the walk in Coos and Curry counties and in our local communities for children and families for the past 25 plus years, and once again find ourselves facing this challenge head on. In the same amount of time, our economic picture has continued to decline and deteriorate, to the point that our community partner collaborations were not only a good way to do business, but imperative to our system to avoid collapse of valuable services and resources to our most vulnerable population, our children. Our collaborative work and spirit will carry us through this next phase of our system-wide transformation. Our working committees will begin the process of defining our hub and bringing those to the table that have to this point not been active participants in our system transformation. Geographically, you see on this slide that is our historically our really the most accurate picture of what regionalization looks for our counties. Western Douglas County from Reedsport all the way to the end of Curry County in Brookings. We go inland to Coquille, Myrtle Point, Powers. We have Agnes up the river down by Ingold Beach. There is just a natural division that has happened selectively, historically, purposefully over many years, combining our services. We currently have regionalized service for our South Coast ESD, Southwestern Oregon Community College, our Southwestern Oregon Community College Parenting Hub, Child Care Resource and Referral, Family Support and Connections, Oregon Coast Community Action, South Coast Head Start, Coos Curry Housing Authority, Department of Human Services, and our SMART program, our Start Making a Reader programs. So we have done a really good job with our collaborative spirit along the coastal community of Southern Oregon. Who we are. Here's an overview of Coos and Curry counties, some of our poverty indicators. Currently have families with children under 18 years of age below federal poverty level. Coos County is at 29%, Curry County is at 25%. Births to unwed parents, 41%, and Curry County has 30%. Single parent households in Coos County, 35%. The data was not available for Curry County. Currently, this is this year and last year's data, we are seeing free and reduced lunch rates of 51 to 84% in Coos County and 59% in Curry County. Unemployment rates, I pulled this off this morning as of October, 10.5 in Coos County, 11.6 in Curry County. We have remained in the double digits for the last 3 years. We have not gone below a double-digit unemployment rate. Our summer lunch programs not this last summer, but the summer before, served 31,362 lunches in Coos County and 9,060 lunches in Curry County. Our total population for our 0 to 17 population is 12,147 for Coos, and for Curry it's 3,296. Of that, approximately 2,000 to 2,500 are the children 0 to 6 that are our target population for this transformation. Our homeless count in Coos County for 2011 and 12 was 166 children through grade 1. Our Maslow project, which serves homeless youth and their families, served 146 children 0 to 6. 194 children 0 to 6 were served in early intervention services that were on IEPs. Women's Safety and Resource Center had 18 children 0 to 6 served, and 7 children in shelter were all 0 to 6. All contributing to the overwhelming need in our community for extended services, but unique and individualized services. Our guiding values and principles, this is just a piece that optimally a comprehensive early childhood system will reach all children and families as early as possible with needed services and supports, genuinely include and effectively accommodate children with special needs, reflect and respect the strengths, needs, values, languages, cultures, and communities of children and families, ensure stability and continuity of services along a continuum from prenatal to school entry and beyond, ease access for families and transitions for children, value parents as decision makers and leaders, and catalyze and maximize investment and foster innovation. This is our hope as we transition forward, that we meet these very core values and principles to provide the best services and resources to our children and families. This slide it was really hard to do. It was one of those that we looked at what do we have? What are we working on? What have we been working on? And our comprehensive early childhood system goals are all-encompassing. We do include our early learning, our education components. We have our health component, as well as all of our community collaborations. Physical development and health, social emotional development, approaches to learning, all of the skills, math, literacy, logic, reasoning, science, could add in there, social studies, could add any of those skill bases, as well as the creative arts and expression. Our goal for our education component is to, in fact, have a pre-K alignment with core competencies for kindergarten readiness. Have our kindergarten students ready to learn, reading by first grade, reading at grade level, and developing our 40-40-20 system for success. A lot of input on what needed as far as making sure that our kids are healthy, physical well-being, of course, adequate nutrition, having a medical home, being immunized and up to date with immunizations, parent-child bonding, having that attachment, access to affordable health care, early intervention referrals, health screenings, access to, I can't see that bottom slide, I'm sorry. Access to mental health services for all children. It's very difficult to have those services available in our communities. And then our next one, we're starting with some of our providers. And these, we highlighted the providers that are our regional providers for this presentation. Our South Coast Head Start enrollment for, no, you were fine, Seth. Yep, no, you're good. For this year, Early Head Start has 56 infant, toddlers, and pregnant mothers with their families. Head Start has 380 children ages 3 to 5 in their families, serving the most vulnerable children and their families based on age, family income, disabilities, and other factors that demonstrate a need for service. Our demographics: below the poverty level, 30%. Eligible due to receipt of public assistance, 38%. Homeless, 9%. Foster children, 7%. 101 to 130% at poverty level, 3%. Over 130% of the federal poverty level, we have 6%. Head Start provides comprehensive services to our children and families with the goal of children entering kindergarten ready to learn. These are the very core focuses that our Head Start programs have. Currently, they have a waiting list for this year in Head Start of 137 children, and Early Head Start, 87. Some of our outcomes for the 4 to 5-year-olds are our Head Start programs from the fall 2011 to 12. In the fall, the approaches to learning grew significantly from fall to spring, from 75.85% to 97.45%. Won't read them all, but the last one, the social emotional development, from 70% all the way to 96%. It's just phenomenal, the rate of return that we have, and the children and their families' investment when they are able to live and go through our Head Start programs. The waiting list would be something that we would hope to be able to not have in our communities, because those students need the services just as much. Our home visiting programs, and our home visiting programs currently are just the information for Coos County Public Health, so all of the Coos County. You'll hear in testimony later on Curry County's Public Health doing the presentation for their piece of what their home visiting programs look like. Once again, we wanted to say that we have providers are public health nurses, public health associates. Of course, our gaps and our barriers, financial limitations, so it's a limited enrollment. There's also the match part that's required. Referrals far exceed capacity to serve, so there's always more than we can actually service. And that we have bilingual, bicultural providers for all of our home visiting programs. Outcomes, once again, 266 children were served, 2,847 home visits were completed, 100% of families' needs were identified, 95% of 2-year-olds were up to date with immunizations, 94% of children had healthcare providers, 45% of children screened for growth and development issues, 83% received follow-up services. Let's see, we've got 97 families with positive parent-child interactions, 97% parents read to their children 3 or more times a week, which is a phenomenal number. We know that the literacy and reading to your child is that growth step to be ready to learn when they enter kindergarten. 65% of our parents report a reduction in parenting stress. As a parent, as an active, working, full-time mom, I know how important that having that stress relief to be able to come home and be the best parent that you can be at the time and be in the moment is critical. Babies First, we have a phenomenal Babies First and Cocoon programs through our Coos County Public Health. Of course, the goal is the infants 0 to 5. It doesn't meet that 6-year-old benchmark that we're looking at. 139 high-risk children and families were served. 1,357 was the number of home visits. Cost of the program is $425,741 annually. Cost per child is $3,063 to serve a child. And our funding streams are Medicaid targeted case management, federal and state Title V match grants. Cocoon, same thing. 83% of the children that qualified for Cocoon were the 0 to 5 population. And it reaches families' optimal autonomous participation in every aspect of the family and community life. 82 of those were high-risk children and families served. 533 was the number of visits made during the last year. $195,369 annually to run the program at a cost per child of $2,383. Again, the same thing, it's Medicaid target case management, OHSU grants, and the federal match or federal block grant. And the last one is our Healthy Start, Healthy Families to promote positive parent-child relationships for the 0 to 3 population and parenting practices in healthy child growth and development. We had 45 high-risk children families involved. 269 families were served with basic services. 745 were the number of home visits to those families. Cost of the program was $150,345 with a cost per child of $3,341. Funding is Coos County Commission on Children and Families, Medicaid administrative claiming, county in-kind services, and grants. Our Parents as Teachers model serves as the base for Babies First, Cocoon, and our Healthy Start programs, with goals to increase parent knowledge of early child development and improve parenting practices, provide early detection and development of developmental delays and health issues, prevent child abuse and neglect, and to increase children's school readiness and school success. Our Nurturing Communities Coalition, you heard a little bit about it yesterday at your site visit. We're building on the nurturing and brain development work of Dr. Stephen Bavlik, who has adopted Coos and Curry County as pilot sites for our nurturing communities. Our partners are across the spectrum: businesses, community members, parents, schools, health providers, service providers. We have a whole gamut of folks that are involved. And our goal for the project is to refine Coos County as thriving, growing, safe, healthy, and nurturing communities. That very place when, I think it was Dick said, that when the 150 doctors come into our community and they Google us, that will be the first thing they see instead of our poverty rate and our child abuse rate and our meth usage or our drug usage or our parents that are dependent on alcohol. So we want to be that type of a community that when the computer opens up, they're saying, we want to be here. We want to be in this thriving community that securely and nurtures not only their children, but their families and encourages growth and development. Children are the recipients and contributors of positive nurturing in their homes, schools, and throughout their communities, and all community members are aware of the impact that positive nurturing has on children as it relates to their abilities to be ready to learn and reach their potentials. As I said, our partners, our list is long and growing. At this point, we have 121 members. I believe that will continue to grow and probably grow until we are done with the project, which hopefully that will be 25 years from now. At this point in time, the gap, we have no funding, so all of our collaborative partners are bringing to the table the resources that we can to be actively involved and move this project forward. Next. Pathways to Positive Parenting, the hub, so the parenting hub for Coos and Curry County. Located throughout Coos and Curry counties, our classes are available to parents of children 0 to 14, trained facilitators. Sessions always begin with a family meal, followed by quality childcare that's provided on site and the parent education classes. The parenting project is integrated in each small community throughout our hub region with our home bases in our public school buildings. The annual report for 11 and 12 parenting classes held 284 classes. 536 adults attended, 984 children attended, 67 sessions were held in schools. Direct cost per child, not including in-kind services for the parenting project to be held, is $91 per child. And our funding source is the Oregon Parenting Consortium, right? It's OPEC?
Education Collaborative.
Education Collaborative. Thank you. I couldn't remember that. Children's mental health, our Coos County mental health programs offering services for our 0 to 6 population. This is just a Coos County, but also Curry County has their piece of it as well. Individual, family, and group therapy using the following approaches: parent-infant psychotherapy, parent-child psychotherapy, play therapy, collaborative problem solving, circle of security, art therapy, neurosequential model of therapeutics, filial therapy, individual, family, and community skills training, intensive community treatment supports and services, wraparound. Nurturing parent program, which we're offering through mental health as well as other agencies. The 0 to 3 program, which some of you had an opportunity to view yesterday, and day treatment beginning in kindergarten. Gaps. We had this conversation yesterday, having additional therapists and skills trainers who are trained to work with the 0 to 5 population to meet the current level of need. It's more difficult to get therapists that are willing to work with that age range. For us that work with that age range, we're kind of unsure why, unclear why, but it is a challenge to get folks involved in the 0 to 5 population. We currently have one therapist at Coos County Mental Health that provides the services for our 0 to 5 population. Cost per child, average cost per child for services that do not include skills training and day treatment is $2,590 a year. 158 children received services, that would cost $409,000 annually. Cost of day treatment for children is $181 a day with a maximum of 9 children. $3,982 per month, or $47,784 annually.
I need to interrupt.
You bet.
I was going to make comments at the end. But when you
That's fine.
When you put a slide in there like that, you got to put what the cost is if you don't do it.
Absolutely.
So we're
that's our narrative.
Oh, I know. But when you're showing it to people like myself, the people that I represent, you need to say that if we do this, then we will have this return on investment. So that it's pretty significant. I mean, those are very. It's not going to cost $500,000 to do this. It's going to be a savings of $5 million because down the road it's going to be a positive return. And I think that it's a glass half full then and becomes a more positive spin truthfully spend on what the values of what you're doing. And so we don't get weighted down by cost, meaning coming out of my back pocket. It's actually an investment in stock, or it's an investment of whatever, because it's going to be helium, not a rock in my pocket to spend this $500,000. So we missed the point on that, and that's where, I'll get off my soapbox here, but that's what we're missing, though. We're missing in the leadership of the community, seeing the value of what we're talking about here. And that was an aha experience for me, finally figuring out that there is an investment that gives you a huge return, and then you get a win-win. You get the bleeding heart who sees the child or the family do better, but then also the hardcore give me a buck back for what I'm spending. You get that too, so you get a win-win. You can go either way.
Thank you for that as we move forward. That's probably the number one, because you even mentioned it earlier and we talked about it, that we have not surrounded ourselves with our business partners. We are beginning that pull into what we have done and what we have always done collaboratively of those business partners, and that is the number one thing that they always ask us. What is the rate of return? What do we get back from this investment?
In some areas where you get the sheriff, you get the police, you get the county commissioners, you get the CEO of the hospitals, they have money also. You can use some type of re-entry money into some of this type of stuff. I don't know what your parents for incarcerated children for incarcerated parents is, right? I don't know what your re-entry trust is, but sometimes all those monies can go together to do that. And if you have all of them at the sitting at the table, you get a DA, you get a chief of police, you get a sheriff, all on the same page. And you can throw in a county commissioner or two. I mean, you can't, and then you throw in the Chamber of Commerce. I mean, you'd be water skiing me on a pretty fast boat.
I'm with you on that one. Thank you.
We'll do it.
My notes are here to be done.
And be sure to get Ken Ware involved too.
I will do that. Children's mental health, we talked about the gaps. So next slide. We have been involved in our county with the safe and equitable reduction of foster care through the Department of Human Services. The goal of the program was to safely reduce the number of children currently in our foster care system. Partners included Department of Human Services, state courts, Casey Family Services, Commission on Children and Families, local tribes, Southwestern Oregon Community College, and our CASAs. Our charge was with children are healthy and safe, families are intact and supported, community is involved, and children are ready to learn. This has been funded by the Casey Family Services through the state of Oregon, one of 8 original counties we were selected to participate. This last year we were part of the Family Fun Day that is hosted by another collaborative community partnership. And we had over 1,000 families that came and participated and spent the day having fun, eating dinner, playing games. It was a beautiful day like this at Toppets Park. Our local tribal affiliation brought their canoe out to the lake right here, and was able, if you stood up and looked out, that's where we had the celebration, is across the lake. They gave canoe rides all day to children and their families. It was just a phenomenal event that really brings together every year, because this isn't the first year that we've done it, the collaborative spirit of coming together as families and showing that there is other ways that we can have a really invested time together with your whole family, mom, dad, grandma, grandpa, the children, all of the children, not just the ones that can walk and talk, but all the children. And it was a great testament to what we did. We had 500 Frisbees, and we ran out of 500 Frisbees, Raise Me Up Frisbees in no time. Kids had them everywhere. It was a phenomenal event. Strengthening, preserving, and reunifying families. We are in the process. June 29th, the governor signed into law Senate Bill 964, which requires the Department of Human Services Child Welfare to provide extensive services to each family through the life of the case. We recently were selected, and we are in the design and implementation pre-phase with anticipated start of 2013 in January, so after the holidays. The tenets we have are severe trauma, which may occur when children are removed from their families, resulting in negative future outcomes. The focus of the directive is to reduce the amount of trauma to children and families by way of offering additional family-focused services, starting at the assessment phase of the case and extending into aftercare services when children are returned to their families. One of the other tenets is we want to improve permanency outcomes for children, and it is most likely achieved when services are offered that allow children to remain in their homes when appropriate and safety can be assured. Keeping our children, or making sure that our children are placed into care, their duration of stay and level of trauma is lessened when family-focused services and routine visits are offered early and often. So we want to make sure that those visits happen more routinely than once a week. Housing is essential to the safe reduction of the number of children in foster care, and that's critical in our communities, is secure, affordable housing. This is a small list, and of many of our grassroots projects that were not highlighted. You didn't see them in a site visit. That some of them are in the room today, but we have been collaborating for lots of years in Coos and Curry County through coalitions, committees, programs, projects, and these are projects and programs and coalitions that are active and been active for many years. I'm not going to read all of them. You guys can see them. We had the opportunity yesterday, and I would like to once again thank our site visit folks at this time, the 0 to 3 court team and program staff, Airport Heights Successful Children Program, Ready to Smile, the dental program at North Bend Middle School. We got to see that in action. Our Family Center, Nurturing Communities and Potential Relief Nursery Center, as well as Educare. And then our Head Start, beautiful Head Start facility that has just opened up this year. And that is the end of our presentation, and I would just like to say once again to all of you, thank you for being here. It was an honor to have you come to Coos Bay and to see what we do in our local communities for Coos and Curry County and how we are moving forward. And we won't be stagnant, we will be moving forward.
Are there questions from council? Yes, Janet.
Early intervention and early childhood special education.
What would you like to know?
Well, why aren't you on this list?
Because I had a family emergency for the last month and a half.
But you are one of the grassroots.
Yes, we are, and I've been part of the committee. I did not get information to be presented in this.
That's okay, but
we are very much,
right.
We are very actively involved, yes.
We'll have to make a small comment to that.
We've held our early childhood committee meetings at the ESP building, and early intervention officers are there, and Cassie and company have been very involved. And we all know our way through her office, and we're secretariat as we work there. And I think it's probably that we're just part of the same, so we didn't pull that out.
I guess I'd like to support that comment as well. Actually, the commission office in Gold Beach is in the ESD office, and Cassie is so much a part of what we do that we were reducing the font size of the list.
I know you're part of it.
Thank you for asking that.
Other questions or comments from the council?
I would use the term, instead of you went that waiting list, which is huge. It resonates to a lot of people who use unserved, because that resonates a cost of not doing. I think we need to emphasize, if we don't do, the negative return on investment, and then if we do, we need to emphasize the positive of the return on investment, so we see that picture. Because there's a real economic issue here of not doing. And we're not talking about widgets here either. No. We're talking about people and individual lives. So that's a little bit of a fraud.
Thank you.
You know, Dick, you made some excellent points about it's a shame that we have to equate dollars with our kids in terms of how we move forward. But I know that it took the same argument to make our legislature realize that salmon were important. They didn't realize until they saw that that's every fish that we raise a return is worth $300 a fish. All of a sudden, if you raise 1 million fish, it becomes significantly important.
Right.
And one of the messages that we need you guys to carry back for us, because it's critical to any of this working, is the ability to diversify our economy and build it. You know, you'll hear that again and again from coastal communities, and that's one of the biggest barriers we have to making all this wonderful work pay off. Because without that, that's the missing piece, and that's the strongest level of support that we need from the state to be able to carry all this forward.
And I'd like to thank you again from Curry County for being here, and I'd like to, everybody from Curry County, to raise your hand. I'd like to see how many folks are here from Curry County. And having gotten to Coos Bay, you know that Curry is way on down there. And we're all here and stayed overnight so that we could share with you, and very much appreciate you coming.
Thank you. I had one question, Barbara.
Yes.
So on some of the earlier slides, you had some metrics about success, right? Outcomes of the kid with the kids and families they're serving. I'm curious as to what's been done so far to try to track that outcome success into kindergarten and into the schools.
A work in progress. One of the things, Coos Bay School Districts, the only thing that we really I wish Lisa was here to speak to this, but Lisa?
I'm here.
Oh, good. You got here. Can you speak to the project with doing the Brigance and the readiness and some of the things that you guys were tracking up to that point?
Several years ago, we used our title funds to do extended day, and we did a developmental kindergarten. And we did it as a study because we wanted to see the effectiveness of it. And what we did is that we funded 2 of our schools to have an extra half-day session of kindergarten for the kids that were struggling. But we wanted to see if it was effective, so we gave every single one of our kindergarten students the Brigance assessment at the beginning of the school year and at the end of the school year. And then at how those kids scored at Brigance, we had a team get together, they looked at the data, they looked at the kids, and we placed which kids we felt were behind the most and could benefit the most into an extra session of kindergarten. And we did that for 2 years until NCLB kicked in and we went into our punishment phase, and they took our money away and we had to put it somewhere else, and then we had to do away with developmental kindergarten. But what happened when we did that testing is that typically the majority of our students came in developmentally at age 3 and not at age 5. There were very few children that were on grade level in all of our schools. So we did see some huge benefits to the extended day for those kids. And actually, those kids just took Oaks as 3rd graders last year, and they're the best scores we've ever had on those.
So I guess what I'm struggling with, I don't even know how to ask this question really. I guess what I'm struggling with is if we're showing incredible outcomes, like 97% of that and 86% of that, right? But yet, and I heard some of this last night in the conversation, but yet we have kids entering kindergarten so far behind. What's there's the disconnect.
It's the number of kids getting into those programs, the waiting lists on those programs, and the size of the community. I mean, and that was just in Coos Bay. I mean, we have Coos Bay, North Bend, Coquille. All of those are feeding into that one program. So those aren't just Coos Bay kids. I mean, there's not enough kids getting those early services. They're just not available, and the waiting lists are way too long.
I actually have a follow-up question because I think that's something that I'm very much interested in. But is there a way that you can determine those students that entered kindergarten that were not ready or that were years behind, were they receiving Head Start programs? I mean, do you track that? What type of early learning services did those students receive that are now struggling in the district, in the school district, once they were, do you hear?
We actually had a meeting the other day about that long ago with Head Start, and one of the frustrations that we had is unless the parent signs off, Head Start can't even tell us that they were in Head Start. So, I mean, that's a problem. I mean, I know the kids that are coming out of early intervention, and I work with the ESD, and I know those kids are coming up into special ed, and we, you know, our school psychologists, at least in Coos Bay, are the ones that evaluate those kids. So we know those kids, but the kids in Head Start, we don't necessarily know without the parents telling us. So that's really hard to distinguish, but there's just not enough services. And it's really, this community has a really, really difficult time with parent involvement. Even events at schools, trying to get parents to come to school is very, very difficult.
So what the statistics show is the majority of our children are not in any program prior to kindergarten. And at the researchers roundtable a couple weeks ago, PSU, Beth Green from PSU shared that 53% of the children coming into the kindergarten there had no group experience. And that's probably not unlike what you're seeing. So when you talk about your scores, you're not talking about children who've had these interventions and this extra support. You're talking about a broad group of people, probably over half of them have had nothing in terms of this kind of educational intervention prior to kindergarten.
And my concern is just making sure that that's so. You know, just how do we know that that's so? If you're not tracking them, if the district doesn't have that information to know who is involved in Head Start, right? So that's just
I wonder if
still a concern.
Excuse me.
All right.
I wonder if it's part of our privy to be kind of a clearinghouse, ma'am, on, we find when we go from county to county that there's some significant, great ideas, being very entrepreneurial, but I haven't heard anything talk about safe families. That's an initiative that's really going well up in the Midlands Valley. Catholic Community Services up there has a great program. They just have a significant grant that could maybe bleed down into here. I mean, we need maybe some type of, I know if you've been in one county, you've been in one county. There's 36 counties, and when I was chair of the Commission on Families and Children, I really found that out. But still, we need the window farm. We need to look out the window and see what somebody else is doing, and not trying to reinvent it all ourselves, and not feel like we're all by ourselves. I mean, you're part of Oregon, and that's pretty significant. So I don't know, maybe it's our privy to be kind of a clearinghouse or get good ideas or something. I don't know how that could work.
I'm going to write that down for a conversation that's coming up on timeline and ideas.
I wonder if Helena could comment on the Brookings kindergarten program, all the kindergarten program as another idea.
We've had all the full day kindergarten, our kindergartens go to school, all of them, from 8 to 2 o'clock every day. And we've done that. We have 7th graders that are for our first ones. And we financed that originally by using Title I funds. The district has slowly picked up the cost of that. We decided that's very important. And it does help our kids. By the time first grade starts, it helps them be a benchmark. We would actually love to fix that, not having everyone having early learning services by having a public free pre-K, so that 3 and 4-year-olds would all have Head Start classes.
Helena, solve our problem. Yeah, I mean, I think it's to your point, in terms of our data for Brookings Harbor, 60% of our kids are not attending preschool. And so it's that same percentage of kids, as Helena just alluded to me, that are not, they're not meeting benchmark because they didn't have any early learning services. Preschool is a privilege in our community. Only 16% of our kids have access to private preschool. And we have 25% of our kids who have access to Head Start. We're a community of working poor. And that truly, really is at the heart of the issue. If all kids had access to a free pre-K public option, I think that we would see incremental increases in their readiness to learn at kindergarten.
I would like to challenge you to remember that parents are their first teachers. They do not have to go to preschool to be prepared for kindergarten. And the early learning services that come through some of the home visiting programs can support parents to become the first teachers. I think preschool's great, my kids went, but I would like to remind you all that we need to think prenatal to 5 to 6 and not wait for somebody else to get these kids ready for school. We have to support parents to get their own children ready to learn. I just really want to challenge you to push it back even further.
I think that the word that you used most important right there was support. We're starting to work with reunifying families after the foster situation. She has families who absolutely qualify for Head Start, and they are fearful and they do not even apply because they are afraid of the home visit. They are afraid of somebody coming in and judging their family and removing their children potentially, because the working poor or the even not working poor do not have a cohesive, supportive relationship in their minds with the greater community. That is an entity that comes in and takes from them. Bad things happen. It's better to cocoon and just do your thing. And therefore, I totally agree with you when we were saying, like, no preschool, and I said to Helena, really nothing. That means even at home. I mean, we literally, I totally agree with the comment about 3-year-old mentality coming to kindergarten. They have not held a pencil. They have not held a crayon. They do not know how to cut. I'm not saying every child, but these are children who aren't, their families are not supported in a way to understand from their own perhaps deficiencies, but from their own childhood. And it's cyclical, it's generational. And so I think the concept of true community support in a, maybe use a touchy word, loving, supportive way is really sort of the disconnect that I'm seeing among our families.
Are there other comments from council?
The other thing I was going to say, Pam, is that as the council moves forward and trying to look at this statewide picture, especially the finances, of course, we're working with CCOs now to see how we can integrate and build service levels if possible. But the other thing we might look at the state level is that there's a lot of federal dollars that are left on the table through federally qualified health centers, FQHCs, rural health centers, critical access hospitals for prevention and intervention dollars, 330 expansion grants. A lot of this would tie directly into this and certainly fit the model across the state, because we're largely a rural state, and actually even work in some of the underserved areas of the larger cities. So I think as you guys advance that, that's definitely got statewide potential for starting to integrate how we build service models.
Thank you. I think we are committed to looking at creative opportunities for how we resource this, and at the same time we want to be realistic that nobody's ever going to come in a bunch of a big truckload of money in our state to do this. So it means having to do what we're doing in a different way, and we're all going to have to do it differently. And we really want to engage you with us, or we want to engage with you in what makes the most sense for doing that. So thank you for that.
I just wanted to add to the conversation about the early learning, because what we do know, we live in a world that's changed with brain development informing the fact that prenatal and the first 3 years is actually what creates the infrastructure in the child's brain. And so the child that gets to kindergarten and the first 3 years were terrible, and they have a disability. Yes, we've missed that opportunity, and we know that the brain is still very plastic till age 5, and that's all well and good, and so a lot of that still happens in kindergarten, but it's that previous thing. And so where are they then? They're at home, and so the programs that can affect the parents, the infants, prenatal, that's where the real jump would be. I was thinking when we were saying that the average is age 3 for kids going into kindergarten, I was thinking, so 50% of them are going to some kind of preschool program. So so they would be bringing the number up. So that means there's other children that are bringing the number way down and they're the children that we talked about that we all have met who never had any mental stimulation, limited mental stimulation, nutrition, all those things that affect IQ. We know that when a child starts kindergarten with a certain vocabulary, that vocabulary percentage ratio will reflect in 11th grade. The brain structure is already there.
So we need to affect the brain structure before they ever get to really get started kindergarten.
Thank you, and thanks to Barbara and Cam and Myrna for presenting this morning. We continue to learn a lot from you, and we really appreciate the conversation. Thank you.
Thank all of you again.
Council members, we are going to take about a 10-minute quick break, and then we're going to move, we'll switch gears. Folks on the phone, we're going to take a 10-minute break. Seth is going to mute you so you don't have to listen to all the craziness in the room, but we'll be back at 10:30, ready to go. Thank you. So lots of good conversation over the break. Thank you. And I would just, if you want to continue your conversations, I would just invite you to step outside the room so that we can continue on with the meeting. And speaking of continuing on with the meeting, so next up is this conversation, council members, about outcomes, metrics, and timelines. And let me just do a little bit of an introduction about what this is about. Can you check to be sure we took the phone? I think maybe Seth knows. Did you? Yeah. Great, thanks. So, council members who have been around for a year, as opposed to those who just joined us a couple of months ago, will remember that we hit the ground running in October of last year at a fast and furious pace. We had our first meeting in the last half of October, and we had our first report due to the legislature a month later. And so we had this crazy pace. And then we had another report due to the legislature in January, so we hastened the crazy pace even more. And as a result of what the legislature asked us to do and what is in statute, we had a series of deadlines that either they set for us or we set for ourselves. And so and we put together a timeline. And so in just a moment, we're going to review that timeline. And I think what you'll see is that we are on track with some things. We are way behind in others. And we've made progress in a few areas. The purpose of this conversation is not to recast the entire timeline, council members, but it is to review what we are to be doing. We now have a full contingent of council members. We now have staff. And so it is to review what we are to be doing, to note where we've made progress, and for you to identify two things. Number one, what else needs to be on this timeline now that we've had a year under our belt in some configuration? What else needs to be on this timeline that is not? And secondarily, we're going to use the timeline as a way to stimulate some thinking about outcomes. And I'll come back to that in just a moment. So back to the timeline for just a moment. What we're going to do with the timeline, Heidi's going to walk us through it in just a moment. We're going to get an update. We're going to have a conversation about what else needs to be here, what else needs to change, and then we're going to ask staff to update the timeline and bring it back to us for a full work session at our next meeting. So this is kind of the beginning. I would anticipate that at our next meeting in January, which the dates are on the bottom of your agenda, that we will look at and approve or adjust a revised timeline, partially based on this conversation, partially based on reports that we have delivered to the legislature, the legislative update that we'll give in December, and so on. Right? So related to this, I'd like you to listen to in addition, to the conversation, or to the presentation by Heidi, and to our conversation among ourselves, with an ear toward outcomes as well. And so you'll remember from some of the previous communication we've had that we need to be setting outcomes in 4 areas, right? And I've noted them on the flip charts, and I'll come to that in just a moment. We need to be setting outcomes for this early learning system that we are charged with. We need to be setting outcomes for the services that are delivered as part of the system. And you'll remember from the governor to the legislature to our conversation last night, the consistent refrain is we are tight and firm, and I think Christy uses the word stubborn, about outcomes, but flexible about how those outcomes are achieved. So it's time for us to start thinking about setting those, I would say the first wave of those outcomes. We also need to set expected outcomes for children and families related to kindergarten readiness and the 5 domains, developmental domains that we are required to address in our statute. And last but not least, we have committed, this is not required, but we have committed among ourselves that we will set outcomes for our work together as a council. So just to stimulate that thinking for just a moment. So just to stimulate the thinking for a moment, and also to make sure the folks who are on the phone have access to this. So Lynn and Eva and others who may be on the phone, what I've done is to create 4 flip charts, and council members have submitted their ideas so far. Janet just did one in the middle of this meeting about what are some of those outcomes that we might want to think about and deliberate on. We're going to note them today, much like the timeline. We're going to note them today. We're going to allow our colleagues who are not here, if they haven't already done so, to submit their thoughts, and then we're going to consider them again at our January meeting. So maybe I can ask Heidi to turn, because I can't read your charts and the microphone at the same time. So for system outcomes, the thoughts that have been submitted for our consideration so far from ourselves and our colleagues who are not here are readiness for kindergarten, which we are statutorily required, so that's sort of a given. Improved health status of children and families, and reduction in foster care. Oh, and on this one, I'm sorry, reduction in special education costs should be up there. It's my fault. Heidi's going to add that now. Costs. Or just maybe in parentheses, I'm not sure. I have to look at my email. Okay, and then related to service outcomes. The service outcomes that have been suggested so far are the percent of children screened for an early identification. We've got that work that's moving forward in the tools. The percent of kids and their families who have a health home to address the health issues, and the percent of kids who have a school transition or an early learning plan in place.
Ma'am?
Yes.
A quick question. I want to be crystal here. The need for client level outcomes.
Good transition. That's the next flip chart.
Oh, sorry.
That's right. You can't see, so thank you, Lynn. So in child and family level outcomes, or client level outcomes, as Lynn just noted, we have 5 developmental domains that we have in our statute to address. Those are physical, cognitive, language and literacy, social and emotional development, and parent and family support. They're shorthanded on the flip charts. But based on those 5 developmental domains, the kinds of client and family outcomes that have been suggested so far are things like, under the physical domain, again, these are connected to the big outcome that we're required to of kindergarten readiness. Right, under the physical domain, that kids are able to safely use playground equipment, the point that was noted earlier in our public conversation about holding scissors and pencils and crayons. In terms of language and literacy, that kids, by the time they enter kindergarten, know letters, sounds, and blends, are able to use multi-word sentences. In terms of family and parent support, the caregivers are able to recognize and respond to a child's needs and cues. The caregivers have their own calming strategies that they employ. And cognitively, kids know shapes and sounds and colors and sequencing, follow directions in a sequence. And in terms of social and emotional development, the kids are able to follow directions, cooperate with others, and can cope with their own needs by the time they enter kindergarten.
Cam, does it make sense? I'm just throwing this out to also have in our goals, or what we're trying to aim for, have unemployment, have poverty. In other words, does it make sense for us to have our initiatives that we're trying to improve upon, but then we also have the drivers that we can all agree upon that affects that, which is unemployment, poverty, and other issues.
Yeah, so to somehow show the connection.
Yeah, exactly.
Okay.
I think it would help us to present our case not only to the legislature, but to the outlying communities that we're trying to get in, outlying citizenry that we're trying to get engaged.
So to show the hydraulic relationship between the work that we do.
Exactly,
and
which I
those.
think that education piece, and I guess I'm reparenting myself, until you have that, you've been around you too long, until you get that indoctrination, you don't get it. So that's
Okay,
just a
great.
thought.
I will note that next. Thank you. That's an important point. And then the fourth area is metrics that would track the progress of the Early Learning Council. Janet added one today to one that had already been suggested. The one that Janet added today was to increase, at least my phrasing of it, to increase a sense of responsibility that we have for all of our children. And then I thought, sort of related to that was submitted by a council member who wasn't able to be with us today, that we would advance the importance of this notion of school readiness in our state. So parents would get it, and doctors would get it, and business people would get it, and whatnot. I think that's kind of related to Dick's hydraulic piece. Okay, so those are the things that have been suggested so far. So council members, what we're going to do is I'm just going to walk through the timeline. We're going to talk about it in two ways. Number one, what needs to be added, deleted, what's missing from the timeline, so that staff can go to work on creating a new timeline for us. And we're sort of piecemealing a work plan together here. And then secondarily, we're going to have a little bit of a conversation about the metrics related to that, so that our work plan is measurable and we're moving forward. Okay?
Thank you, Chair Curtis and members of the council. I will go through this pretty briefly. So you do have a copy of this in front of you, and we have the PowerPoint in front of us. This is a 2-year timeline that was, as Pam said, drafted a year ago. I have bolded areas that I believe we have accomplished or at least made pretty substantial progress in, and I'll highlight that as we go. So in the first quarter, the first slide, the first quarter of 2012, last year, we had said that hubs would determine the administrative level of services at the state level and also at the local level. We said that the family resource managers, we would have a position description and a number of who we thought needed to exist in the state. We also said we'd do an inventory of the current family resource manager functions, which we have done so as of the report done in September of 2012. We also said we would have a synchronized transition from county commission system and changes in the programs not funded through the Commission on Children and Families. We said we would have a director hired, which we thankfully have, as of August of 2012. We then would have a master list of services, the purposes, and the roles of all of the services that we have in Oregon. We said we would have a data system vision, a data map, and a timeline. We did accept a report in May of 2012 that did do that, so that is one of the accomplishments. We said we would have a centralized access point for families to connect with the hubs, for example, 211, something like that. We also said we would adopt a Head Start Child Development Early Learning Framework for the systems 3 to 5, and that this framework would be required for Head Start and OPK. It's already required for Head Start, but our OPK programs would follow suit. We did so with the adoption of House Bill 4165. That's been accomplished. So moving to the second quarter of 2012, we said that hubs would identify infrastructure needs and determine geographic distribution of hubs, and that this would be synchronized with the transition plan from the county commission system. We would then create intensive training for workforce transition and finalize system evaluation metrics. We would expand the early learning database. We also would identify universal screening tools. We accepted a report as a council in September of 2012, a suite of screening tools, so we have made progress there. We would develop screening metrics and align with payment in the healthcare system, such as with primary care homes or CCOs. We then would identify a kindergarten readiness expert who would help us select a kindergarten readiness assessment tool. That has been done. As you know, it's currently piloting in 16 schools right now. We then would create an outreach and inclusion plan to connect underserved communities, kindergarten teachers, and parents with Early Learning Council for kindergarten readiness assessment. We would implement a tiered quality rating and improvement system. This is currently underway. That has made progress. So third quarter, 2012, we would implement an initial operational data system. We would develop strategies to address weaknesses in our screening tool. We would create a plan for evaluation and modification of universal screening tools with changing evidence. We would pilot the kindergarten readiness assessment. That has been accomplished. We would develop a financial model and present it to OEIB. We would expand outreach and marketing for childcare. Moving into the fourth quarter, which is where we sit today, we would determine the numbers needed of family resource managers across the state. We would implement a first grade reading assessment. Moving to first quarter 2013, we would establish hub and provider contracts with a synchronized transition from the county commission system. We would mine the database for our first set of outcomes. We would implement universal screening tools. We would augment the workforce knowledge and competency framework, which is currently the early childhood professional development system housed at the Center for Career Development, that would be expanded across the early childhood system. We would evaluate the pilot kindergarten readiness assessment and adjust accordingly. That is on target right now. We would evaluate the database and adjust accordingly. The second quarter, moving to the second quarter of 2013, we would align the Head Start Child Development Early Learning Framework to the K-12 Common Core standards. We would then revise our Birth to 3 standards to align with this framework. Moving to the third quarter, we would hire or contract hubs, family resource managers, and providers. We would implement the kindergarten readiness assessment statewide, and we would implement statewide training of early childhood professionals. In the fourth quarter, we would then evaluate the system using determined evaluation metrics and report on our implementation process. All of these activities would include ongoing activities such as stakeholder engagement, support for smooth transitions, aligning policies and outcomes of statewide subsidies, slots, and supports to help children at risk access quality care and education services. That was our aggressive timeline a year ago. And I just want to highlight and make note that as we start thinking about revising a timeline, you have in your packet I think it's gray in your packet. I made it in orange, and I will, yes, Dick, note that this is colors of Oregon State University, go Beavs. This was the beginning of my thinking to get wrapped around our work plan that we intend to build out after your input today. That really is just an assessment of our initiatives and our work groups and actions to date, next steps that we have currently planned, and a proposed timeline here. So this is just an initial thing. I like things on one page, and it was just to get my head started in this direction. So look forward to your feedback today.
Great, thank you very much. So council members, thoughts first about the timeline and what is missing, what needs to be, obviously a lot needs to be adjusted. We are way behind in many ways. And we hear this interesting tension between you're moving too fast, you're moving too slow. We need to make some adjustments. But what are your thoughts about adjustments at this point? We're going to do timeline first, and then we're going to do, and then we'll do outcomes. So
I think the context should be in the early childhood development or the brain development. 80% of the brain is developed in 36 months. And so we have 24 months here that we're going to be messing around here while the child is developed 2/3 of the time. I've always heard the comment that it's okay to be excessively impatient if you're on the Titanic. I encourage us to keep moving along fast as we can.
Great, thank you. And it is an interesting concept to sort of think about paralleling this with the developing brain of a child. That's an interesting way to think about it. What else, council members?
Can I just I having been involved in the CCO conversations, which are kind of paralleling this work, I really ask us to be very conscious that this does not cause disruption to families. That was the whole point around the CCO work, and that has not played out truly. And so I really want us to be very thoughtful, as yes, we need to be quick, but being very thoughtful that families do not suffer.
So I think that we all agree with you, Terry. I know we've had a lot of conversation about that, and that's a really important principle. How would that get actualized in this time? I mean, what needs to change here, if anything, or is it just something that you are reminding us to keep in mind?
I'm reminding us to keep it in mind as we talk about how the new hubs are going to work, and that we're really conscious as we approve hubs that systems are in place to make sure the service delivery happens.
Dana and then Jim.
My addition is just a lot more specific than that, but it was, I think Heidi identified that our group accepted the screening tools work group, but that our screening tools work group still left a big open space around family well-being, and so for that to land somewhere on our timeline, how we're and when we're going to address that piece.
Great, thank you.
One of those new ones. So I don't necessarily have to own the timeline that was laid out, but from having been on here, I've been paying attention since May, I guess. I think what's happened is you start out with a vision, which is by its nature reductionist. And as you go through the process, you become more knowledgeable and adapt. And I think that's exactly what we're doing. The hubs are a great example of that. We're realizing that it's a lot more complicated and we don't want to break fast.
Pam?
Yes,
one thing that strikes me is that many of the things we set out to do, we will be doing with other organizations. I don't think that leaves us a responsibility. I just think the timeline, to me it means we need to expand our thinking about the timeline, because the work may be by more intense relationships. I mean, those of us who worked on that data, and it was recommended, I mean, it was adopted, we adopted it, but there's a lot of other players that are really going to determine what kind of early childhood data system we're really going to have. So it seems like the timeline needs to encompass the relationships that the council has to nurture. We're not going to achieve these outcomes by ourselves, and so it feels like the relationships and how we're going to build them and maintain them needs to be part of the timeline.
Great, I had a similar reaction, Bobby, and mine was around first overall, and then a specific around the first grade reading assessment, because I know that is something the Education Investment Board has talked about, feels strongly about, and wants to put aside. We have it on our timeline to do, but they want us to put it aside. And so I think there are those kinds of things that are, that reflect dependencies and relationships, if you will, with others that have not been, as Jim said, incorporated into this. So I would want the staff to do that as we make adjustments.
Could the staff look at any low fruit, that's something that could be tackled almost immediately with some really good results? And I don't know what that is, but is there a possibility for that? Is there a consensus? I totally agree with Bobby, but is there any consensus that there's something that can be done right today or yesterday?
Great. So far the principles, if you will, as in terms of asking staff to make adjustments, include things like low-hanging fruit and incorporating those relationships and dependencies on others. Other reactions? Janet?
I was thinking about change and did a lot of reading, because in early childhood there's change every day. But we had a lot of researchers and work with them, and the bottom line is that change takes 3 years at a minimum. Complete change and adoption of the system. And then the William Bridges thing on, when you're kind of in limbo, like you have not let go of this system, you're reaching for this system, and then you let go and you're here. And I think a lot of our people feel that way. And so when I think about slow change versus fast change of systems, I think the process is going to take an amount of time no matter what. And so in some ways, I'm for just going ahead quicker because it's still going to be a few messy years. But we have tried in the past going slower, and it's easy to just keep hanging on from here. And then my other thought is, my kids were born around 1990 when the tax structure was changed in Oregon, and things just slowly went downhill. Maybe it's just been quicker, and we picked ourselves up and been in a different place. So I think we have to be mindful of. The next 3 years are going to be tricky, and we do have kids very young, like Dick said. And I don't think it's a helpful thought, but it is on my mind that we need to think of. There are some things that aren't scientific, there's the human process, and how do maybe we just have to talk our way through it.
Great, thanks. Others?
Just a comment. Well, I know that the design of the early learning changes was important, and you guys met a lot. I wasn't involved in that earlier process. I do think that this, right now, we're at the implementation stage, and I still think that is just as important as the design phase, if not more, because people are waiting for some responses. And so I, for one, would be, and I know right now the council is meeting every 2 months, but I, for one, would be willing to work to meet once every month or more if we need to, just in order to start getting together more and getting this work to flow much quicker.
Great, thank you. And I think we have heard some of that and planned in January. So for folks that are either watching us or are here in January, we will start monthly meetings. Other folks on the phone, in terms of timeline, anything that you have to add at this point?
No.
Okay. So I thought there were 2 things that I thought were missing that we've been working on that aren't reflected in this timeline. One is the joint committee with the Oregon Health Policy Board to figure out the interface between this work and the health transformation work. And second, it's sort of inherent at the bottom of this, but it's not very explicit, and that is communication. And I think we've learned from these meetings that we've been having and visits with folks like we had yesterday, the real critical nature of ongoing 2-way communication. And sort of the mechanisms for doing that are not reflected in this timeline and should be. Anything else, council members? Okay, so, I'm sorry?
I don't think this really ties in. We talked a little bit on the break about we need to, in my opinion, give communities and programs a way to put their return on investment. Because like the court thing we saw yesterday, I would sit there, like I said, I've been around Dick too much, and say, well, how much does this cost? You could figure out your costs, and then what is incarceration, what is cost of care, you could do that. But, and I say, but in my own programs, I had trouble thinking about that, and Marna goes, well, there should be an administrator who could figure that out. And I said, well, that was me. And I felt kind of bothered. I said, well, we're saving this amount of money, and then I broadcast, and I go, well, you're in Clackamas County. What do you? I mean, if there would be some way we could help have a statewide loose metric of how do you figure, how do you show that to people? Because that was I knew, and then you think, how much time am I going to put into that? Because I know I'm doing a good job, and I just can't spend my time figuring all this out.
Okay.
But I think it is important.
Yeah, it's almost, I mean, it's partly how we communicate about it and what are sort of the basics or the templating, if you will, for consistent communication across all of this. Return on investment being one of them. Okay, very good. All right, so what I hear is, and I think what we do now, and I'm just going to double check the staff, but the plan is for Jada and her team to update this timeline. Kind of our principles were to incorporate the relationships and dependencies piece, and our interdependencies, I should say, with others. Identify low-hanging fruit if possible, and keep pushing forward. Be mindful to not drop things, but we need to keep moving forward. All right, and so we'll get that updated, and it'll be back in front of us at our next meeting, which is in January, to approve an updated timeline. Okay, thank you. So related to that then is this conversation about outcomes. and outcomes in 4 particular areas. Again, this is sort of a let's get it jotted down, let's note it. This is not an official work plan. We have lots of folks who want to participate in this who are not here, and some of whom submitted thoughts. What are some other thoughts that you've been having as you think about the work plan, timeline, the work in front of us?
And we've got some ongoing, we've got work groups, and they don't show up clearly in this. Most organizations as big as ours, or councils as big as ours, can't work as a whole. And so I don't know if it's in the timeline or in probably in a work plan, but being more specific about which tasks are being assigned to work groups. Right? Because I would think that's how we're going to make quick substantive changes through small groups who are meeting weekly and doing
and then
hands-on work.
On those work groups, who are the leader, the chairman of that work group, the leader of that work group, normally then would be into the executive committee, and then they would carry a lot of the water.
So maybe one of the things we need to look at in relationship to this is just sort of our structure. Because we do have an executive committee, right? But it is not, but it was early on, it was established early on, almost a year ago, for the purposes, and we have a report coming up, for the purposes of making decisions in between council meetings. But at that point, we had not yet formed any committees. And so kind of alongside of this, we need to sort of figure out what the structure is. Then we may need to recast that executive committee or other things. Okay, great. So we can look at sort of looks like we're going to have an organizational type meeting in January.
I would encourage to look at a college model of a board, where you have the commissioner of the membership, and then they are divided out to different committees, but then whoever chairs of those committees refers back to the chair, and then they carry a lot of the decision-making process that needs to be done.
Okay.
They're intertwined. And report back to the group as a whole.
Great. Other thoughts about that? Okay, let's turn back to outcomes then. Are there any outcomes at this point that have struck your fancy, other than those that are here, that we should be considering, we're just getting on the list for consideration in January?
What do you mean by outcomes? Let me give you an example. What are we saying?
It's the so what factor. So, for example, and we have to, we really need to address the so what factor in 4 different areas. Actually, 3 different areas and one that we've added for ourselves. So let's start with the kid and family one for just a second. So to Lynn Saxton's point, Lynn is on the phone. Lynn really wants to make sure that we've got client or child and family outcomes. So we heard lots about services that were delivered yesterday, today. There needs to be so what. It's nice to give kids services, but what happens as a result of that? We hope, let's just pretend that what's up here on the flip chart are the outcomes. They may not be, but let's just say they are. We would hope that every kid who has services that we heard about yesterday and today does these things, or their family does these things when they enter kindergarten. And then we've got, can we go to the service level ones? And then sort of the next level up, sorry, I didn't do them in order. The next level up was sort of what do we expect the services to do? We're used to hearing about outcomes as outputs. We deliver, and we saw some of those this morning. We delivered services to, I don't remember, 247 kids, 200 whatever got Head Start or EI or whatever it was. That's not what this means. What this means is, as a result of that, at a service level, what was the result? We had an increase in number of kids that were screened, for example. That's one of our charges in statute. We're supposed to screen and identify all kids. So somebody suggested, and probably understandably so, that an increasing percentage of the number of children screened would be an important outcome of the services that we deliver. And then kind of the next level up is the overall system that we're in charge of. When we're sort of given some of those outcomes, we have room to add or adjust others. And then finally, we've said, if we're doing our job, we need to hold ourselves accountable for outcomes as well.
So Pam, one reflection that I have is these are for many of these are population level measures, or they could be either that if a child was touched by a dollar that came through the ELC, then that child had to have these outcomes. But the other level is that I think the ELC as a council is more population based. Are we moving the marker for all children? We're not going to have resources to touch every one of these children, which is why these community engagements, the kinds of things Dick's talking about, are so critical, because we're not going to have resources to reach that 53% of children who now are not in any program, any early learning program at least, before kindergarten. So it feels like we're talking two levels. That's all I'm saying, is that the council needs to be tracking what's happening to all our children, and then there'll be a more performance monitoring level that goes with people who use dollars that come through ELC, and that we don't want to have one or the other.
I guess that's how I was thinking of kind of the client level outcomes could be individual child oriented, whatever they end up being, right? Whereas the system outcomes, or the outcomes that we're focused on as an ELC, are more of those, as a state, are we getting more kids ready to learn when they enter kindergarten? Are we, that's how, so I was sort of thinking that was here. Maybe it's not, Bobby.
Well, I mean, on the service level, percent screen, percent healthy, have a health home, these things, we could probably be doing those on population level also.
Yeah, right.
So I don't know, I haven't got it all thought through, but it feels like
some of those
we've got
could double.
two levels of tracking that the council will be monitoring.
Yeah, okay, thanks. That's helpful.
The two levels that are, but I cringe when we talk about picking and choosing. Yes, 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 no, yes, 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 no. I had a business outside of Warsaw. Also, it reminds me, we're talking about people here. So how are we going to raise, how high tide going to raise all boats? Are we going to keep monitor how all children are going through the system? Is the goal too high? Then we're not going to be able to do 100%, but we can hit. But if we don't aim for 100, maybe we'll do 80. If we say, we can do 53 and we hit 47. You know what I mean? So
well, I think
it's a philosophical question that needs to be answered.
Well, and I think that was what Janet was trying to pose for us by saying it's all kids.
Exactly.
And I think that we have that as our goal, understanding that in the ways that we currently deliver services, we will not have enough resources to serve all kids. So, and nobody's going to come dump $3 billion in our state to give us enough money to do that. So if we have $1 billion, and we actually have more than $1 billion every 2 years in this state to serve kids, little young kids, not including healthcare. So how do we do that in a way that gets us as far as possible toward that 100%? That's really the question.
Right.
Are you saying, I'm trying to get what we're doing. So we've got screening. And I'm with Dick on we say 100% or 80%. Let's just say 100% of children arrive have been screened in those domains prior to entry into kindergarten. And of that 100%, 80% of them will have had any identified needs met. Or is that what we're trying to say? What our goals are? I think that we can measure. So there might be a few who have things that weren't picked up, birth to 5. Is that or not?
Yeah, I think there are multiple levels here. Obviously, we are required to set outcomes. Mm-hmm. We've said clearly, and the governor has said clearly, we're going to be tight on outcomes. We're going to be flexible on how we get there. But we owe these folks and everybody else
some goals to shoot for. And we owe it at a child and family level and a service delivery level, and we owe it at a population level that we can talk to the legislature and the OEIB about. And
So are we looking at that concrete in those areas, the concrete, measurable, and then we could adjust it as we get more information, but
That's
start somewhere?
I would say this is the first wave, and I would say it's not going to be perfect, and I would say we're going to get proxies. We're not going to get perfection. So, yep. Yep, hey, and the queue, we'll come to Lynn in just a second. In the queue, we have Terry and Jim and Dana and Dick and Lynn. So, Terry?
So I think part of the struggle is we continue to look at this as how will the same people that are delivering these services now ever manage to do this with no more money? And the piece we keep forgetting is we're working to engage this as a system, and we're already talking about engaging new partners. So if we have a way to track every pediatrician's office that did screening and every primary care provider's office that did screening, we're not talking about community-based programs doing all this screening. We're talking about how do we build those connections that are already happening in buckets. I mean, this stuff is already happening in buckets, but how is there this smooth, seamless system where every child gets screened when they go into the doctor, and then the doctor or the mid-level provider, whatever, and then they know how easily to refer that family to somebody that can serve needs if something's identified, and then did those identified needs get met and transitioned to school? I mean, that's to me the biggest issue, is not that everybody's not doing good work, but we're not connected to one another, and that child is not followed through their life. And if we can just show where that connection is, so we're not doing things 2 and 3 times to the same kid, we're going to show great outcomes. Because we're all doing really great work, but we're doing it in buckets, and we need to build those connections and see ourselves as across the continuum of that child's life.
Thank you.
With no more money.
I have Jim, Dana, Dick, and Lynn.
So, thank you. I want to say that I really appreciate Bobby's comment. I think it's really easy for us to mismeasure by thinking populations and service delivery are kind of the same thing. The good example of that in my area is poverty, because that came up today. If you look at the data about the war on poverty, we dropped from 22% to about 15% and stayed between 11 and 15 ever since. But that has been variable almost entirely due to the economy. We don't have control over the economy, so we have to be careful to measure the things that we have control over. I agree that we need to measure the population. I would argue that measuring the impact on the population is a measure of this group and of Oregon as a whole. That measure of their success with individual families is a provider level measure, and the hubs stand between. We should ask the hubs what they're doing to do, as Terry said, and make sure that every kid is screened and try and get at that larger population data, but recognize that it really matters how we think about these populations. We got to get it right.
Great. Thank you very much. I'm making notes of this. We'll have something to propose for Heidi to write down in just a minute. Dana, Dick, and Lynn.
So the couple comments that I have certainly relate back to health, of course, and one is the client level outcomes that have been listed here, and looking at the physical component, it seems that those two kind of holding outcomes are really focused on motor development and very important. But I think still this comes to this coordination that Terry just alluded to across health. So there's going to be other really important physical health factors that relate to kindergarten readiness. So we've talked about vision and hearing and oral health as some examples. And so I think part of what I'll talk about in a little bit is a subcommittee joining health and early learning. But how do we think about joint outcomes that we both really are invested in and responsible for, and how does that look for a product from the Early Learning Council? So I think there's physical outcomes that are missing there, but how they actually work in coordination with health are really important.
Great.
And then one last comment is on the more system outcomes. Health is mentioned again, and I think again this gets to some of what Jim just mentioned, is to look, my hopes are that we look beyond, but of course not ignoring physical, behavioral health broadly, thinking about health, but also thinking about health not just on the individual, family level, but on a community level. And so again, certainly we know the underlying issue of poverty and what are we going to be able to move as a council, what we can't, but I think thinking about at least more upstream some of the social determinants of health, access to healthy food and housing are some things that I think we should bring up about how we may be able to address those.
Great. Okay. So we have Dick, Lynn, and Marlene.
Well, the miracle is that being in the queue, that I remember what I was going to say.
We're trying to help you out, Dick.
Well, I go along with my bucket lady here, and connecting those dots. But if our goals, part of our goal is to get the sweat equity involved in the communities that doesn't cost a dime. So I think that's something we have to focus on is how do we connect the assets of our community to getting those people to get off their assets. So I think that's should be part of our goals. That won't be looking at X amount of dollars to have a goal, but also to integrate our whole community.
Thank you. Lynn and Marlene.
Well, I think been largely said. I just want to underscore that I think our opportunity is through the use of current state of technology and such is to integrate the great work that is being done now to drive to the outcome we need, which is to reduce at the front end of the process the number of kids that fail to cross the finish line into careers and work and follow life trajectories. So I think someone said that 2 people ago, so I don't need to talk anymore, but I do think we can, if we use our tools, we will integrate the work currently being done successfully to produce improved outcomes.
Thank you very much. Marlene.
Thank you. In the system outcomes, I didn't see mention of part of our charge, which was not only readiness for kindergarten, but also reading by the end of first grade. And so I wanted to include that as far as our outcomes, and just because that's a big piece that we're going to have to integrate early learning services in with the school districts. So just wanting to include that first grade piece as well.
Great, thank you. So here's, in the interest of time, I'm going to start moving us along. But so here's where I think we are, and then there's going to be a lot of this that will come back to us. Staff is going to do a bunch of work between now and January, right? So I think what we've said is, and I'm not going to hit everything that everybody said, but we really have sort of 2 buckets, types of outcomes, right? Population outcomes and individual outcomes. The population outcomes are most appropriate for the as it's currently categorized, right? The system and the work of the ELC. The individual outcomes are more appropriate for the provider level and for the service level as it's on the flow chart, and then client. The hub, which we don't have up here really anywhere, right, lies somewhere in between. And I identified in the conversations and the feedback that you just gave 3 potential hub outcomes that aren't reflected here. The first is to increase connections and decrease duplication. Second, to increase the effective use of resources, and these are related and they may not be exactly the right way to say them, but our staff can help us with that. And the third is to increase community assets and integration. Dick's last point. some of those ought to also be, I've heard, the work of this council in terms of decreasing duplication and increasing connections to healthcare, to schools, to what have you. And if you're on the phone, Heidi's madly writing on the flip chart. Increase connections, decrease duplication, increase. So do you have decreased duplication?
No, not the same part of that, or?
Increased effective use of resources.
And then effective use of resources. And then this point about increasing community assets and integration. So I think we have an ample and adequate starting place for further reflection in January. I would like everybody to think a little bit more about this. We'll get some material out to folks in the interim so that you can be thinking about it. But we will, again, we need to set some what I'll call initial measures, a first wave and proxy measures. We'll, to Jim's point, we'll continue to learn and refine this as we go. All right. Anything else on this before we move on?
I'd like to ask, with your permission, if we take these three that you just mentioned to the hub work group, because we have 2 council members on there as some beginning to let them have a little bit of input.
Great, that would be great. And it seems that the broader population outcomes that we're talking about for the system and the ELC might also inform the hub conversation. That would be great. Okay. All right. Thank you very much. All right, let's move on. We have executive committee report next, and we'll try to be as concise as we can with this. So good, Krista's making her way up. All right, so the first thing on the agenda for executive committee report is the comprehensive children's budget. Before I do that, I just remind council members that at your last meeting, which was in September in the Dalles, you empowered the executive committee to deliver to the legislature 3 reports on your behalf, and you had seen drafts of some of those. You've seen the final version since, and the executive committee did indeed make some adjustments to all of them and submitted them on your behalf. You've seen the final version of all of them. We're going to just briefly touch on each and then see if you have any questions or need for further information at this point. In terms of the comprehensive children's budget, I think the primary thing I want to say about this is that there's a lot of what is this and what isn't it, and I want to just try to touch on this very briefly. First, what it is not. We were charged with delivering a comprehensive children's budget to the legislature. It is not a laundry list of the funds that ought to come through hubs, through the Early Learning Council. It is not a consolidation of resources. It is not a suggestion that programs move here or there. It's not everybody's worst fear. So what it is for the first time in Oregon's history, one place where all early learning funds, with the exclusion of healthcare, is recorded in one place, in one document, and it's a beginning. There were judgment calls that were made along the way, because there are judgment calls, for example, healthcare, immunizations. Does that get included? Does that not get included? It did not get included, but it could have been included. So there were some judgment calls, but you'll see, if you haven't had a chance to look at it, and I would encourage you to do that, a pretty impressive array of program services and resources that this state has for young children. And it's the point that we talked about last night, and it's the point that we've talked about so far today, which is we have a lot of resources available to support our kids. We're probably not going to get a lot of new resources anytime soon, so it's really a question of how we deploy those resources. Where do we need flexibility from the state for our friends in local communities? Where does the state need some flexibility maybe from federal regulation? What is it that we could do? What do we need to do to more effectively deploy those resources? I would anticipate that as the hubs move forward and get established, that one of the things we will ask hubs to do is to do a similar sort of accounting exercise to investigate and find all of the resources in their community for early learning, which includes some of the community assets we could not put forward in a comprehensive children's budget, community by community, because we just don't know what those are. So that's what this is, that's what it isn't, and it has been delivered to the legislature. Are there questions or comments about the children's budget? Okay, let's hear from Krista about the Family Resource Manager report.
Thank you, Madam Chair. We are happy to note that the process that we underwent was a survey that was supported by a number of community partners. Our charge was to identify availability, resources, and functions of persons acting in family support work across the state. It was a significant effort to try to identify who we might connect with and who might be able to respond to our survey. In the end, we had close to 2,000 respondents, and about 1,600 of those were the basis for the entire study. The survey really centered around a major question that asked folks to identify the amount of time that they spent in a number of family support functions, and that was the core of the survey. The findings that we would want to report to the council and were in the report submitted to legislators that family support functions are available across the state. They're embedded in a variety of different programs, and they are active. There are significant focus on specifically children 0 to 6, and possibly some room for working around prenatal. The indicated percentage is 26% of clients have wait lists, and most of those clients are being seen within 2 weeks. And so there's a significant population of these family support functions that are already being delivered across the state. In terms of resources, over 80% of the family support workers have bachelor's degrees and associate's degrees. They're well educated. They've been in their jobs on average for about 6 years. And so they're educated, motivated by family-centered, strength-based approaches. The model does seem to emphasize long-term case management with significant time and resource spent in administrative functions, which might be duplicitous. So a lot of time, about 26% spent in intake and paperwork, documentation, and we were unable to identify if one program's response about their intake time was for the same family as perhaps another program, and so there's room to be evaluated there. In a nutshell, it appears that Oregon is ripe for harnessing family support workers as a valued and professional cross-discipline resource to support at-risk children and families in the state of Oregon.
Questions? Comments?
Is the report on the website?
It is. It's on the OABI.
Thank you.
Thank you.
Other questions or comments?
So, Krista, what I think I heard your last comment, what I thought I heard you say is that there already is an infrastructure in Oregon, or a semblance of an infrastructure in Oregon.
There are already persons who are acting as family support workers in the state of Oregon, and this was our initial attempt to identify how they're spending their time and where they are. Yes.
So again, it just sort of supports this notion that what this is not about, even though we've identified and is in our statute, family resource managers are a pivotal point in our service delivery transformation, just like care coordinators are on the health transformation side of the world. What we are not about is going out and creating and hiring a lot of new public employees to do this. What we are about is thinking about this as a function that gets deployed, and was in many of the services that we looked at yesterday, and how do we maximize that and capitalize on it. So this survey was our first attempt to try to define what the universe is out there so far. Okay, great, thank you. So turn to Dana then for an update on the joint ELC-SLCC report.
I will keep this brief. For everybody, as you may recall, the House Bill 4165 directed the Early Learning Council and the State Interagency Coordinating Council, which directs early intervention and early childhood special education programs, to come together as a joint work group. And we were due to submit a report to the legislature by the end of September 30th, which you can see for complete details is available on the web. So just briefly to review the legislative charge for this joint work group, the group shall describe the unique complexities of providing early childhood special education and early intervention services, and shall make recommendations for possible ways to better coordinate and improve the delivery of those services. So that was our charge. There was a 15-member work group, and we had 3 long facilitated meetings to get to the product of our report. And I would say overall that it was a really wonderful experience. We had some very open and frank conversations, and I think everybody felt that it was very valuable. I'm not going to go over the details of the results. I would just say in general, the unique complexities we spent a lot of time thinking about, and the ultimate result of that list was not that any one of those factors was unique only to EI or ECSD services, but may have a combination of uniqueness and complexity. So just a couple highlights that were identified: the qualified and adequate staff needs of EI ECSD services, and particularly across geographic locations, the fact of the complicated entitlement and state laws, reporting requirements, the issue of not being allowed to have wait lists, the requirement to coordinate significantly with school districts, a real focus on child level goals that are individualized and not based on test scores, and a role that they felt was really important as helping those families navigate many services which many of you experience. There are many recommendations focused on screening, build on the seamless system of the EI ECSD system, utilize EI ECSD staff to support children with developmental delays and disabilities in inclusive environments, and to help address challenges with coordination across programs, including our federal privacy laws, HIPAA and FERPA. So that was just an overview, the flavor of what came out of that report. I think everybody really, again, felt it was valuable and really identified alignment as being really important. I'm happy to take questions.
Questions? And the report is on the website, and you've all been provided with a copy of it. Okay, great. Thank you very much. All right, I think next is our overview of the work that's being done in our home visiting system. So I think this is Terry and Christy Peoples. So council members who are on the phone, we do have a PowerPoint in front of us, but we will be referencing the home visiting system chart that is on page 4 of your packet.
Okay. Good morning. So I want to thank Christy Peoples, first of all, for creating the PowerPoint before she flew away for vacation. Very helpful. So there's been a lot of work with home visiting programs in the state that actually preceded the work of the Early Learning Council and is kind of happening in a parallel manner. And so we wanted to give you an overview of that work so that you understood where the home visiting programs were going, and we want to make sure that the work is connected and not going in different directions. So go ahead and go to the first slide there. So in the fall of 2009, 5 state agencies, including the governor's office, met to discuss opportunities to better align home visiting services across agencies and programs. And then that next spring, cross-agency, cross-program home visiting steering committee was formed to guide the coordination and collaboration efforts. And these were all state-level program directors, and that's where the energy and the work first started. Included the governor's office, DHS, the Oregon Commission on Children and Families, Public Health Division, the Head Start Collaboration Office, and then the Home Visiting Steering Committee expanded that to include ELC staff, child care, Oregon Department of Ed, the Early Intervention, Early Childhood Special Ed programs, addictions and mental health, and the Ocean office, which is at OHSU. It's the Office for Children and the Office for Children and Youth with Special Health Needs. And the next one, Seth. And then in the spring of 2010, the Federal Patient Protection and Affordable Care Act was passed and included maternal, infant, and early childhood home visiting program and related grant program. And of course, we saw this as an opportunity that Oregon could take advantage of. And then in early 2011, the home visiting system design team was convened, and that's where my involvement in the process began. And I actually sit on that design team as a representative of local cocoon programs, which is the care coordination for children and youth with special health care needs. So that team includes tribal partners, a parent/consumer of the services, child care, state and local representatives from all the state-funded early childhood home visiting program. And the public health nurse programs include Cocoon, Head Start, Early Head Start, and then Early Intervention, Early Childhood Special Ed, Healthy Start, Healthy Families of Oregon, Relief Nurseries, Family Support and Connections, and Child Welfare. We're all there at the table. Lots of tables. Interesting meetings. And then a statewide home visiting needs assessment was done in preparation for applying for the MCV grant. There was a webinar done in September of 2011 that showed the high-level findings. The final report was released in October of 2012 and is on the website. The thing that we found was most exciting was that finally we had some documentation around what were the unmet needs, what were the most needed services, what was difficult to find. There were interviews done with parents and home visitors to compare to see how those things were viewed by both groups, and the inequities in the system. There were over 800 surveys done of home visitors and families. There were over 4,500 surveys done, which is actually a pretty good representation. As a local home visitor, something that came out of that survey that was really exciting to me is information around this notion of families receiving more than one program at the same time, and then there's no local coordination and people are knocking on doors and passing in the street on the sidewalk. And the survey showed that, the assessment showed that 84% of families participated in one program over the year that was assessed, 2010 to 2011. 13% participated in two programs, 3% participated in three or more, and then less than 1% participated in four or more. But there was really good explanation for why families may participate in one or more. For example, you're spanning over a year, so you may see a family that participated in a prenatal program, and then the child participated to Babies First or Early Head Start, a program that started visiting after. And they can graduate from one program to another. For example, they're seen in Babies First and then they went to Head Start. Or children with developmental delays are often seen in more than one program. For example, they have a nurse home visitor who's doing case management with the family, but they're also receiving in-home therapies from Early Intervention, Early Childhood Special Ed. And additionally, some kids that are really affected have that, as well as they're in a Head Start program, and Head Start is mandated to have a certain number of their kids that are receiving special ed. So we really felt like that duplication and programs knocking on the same door myth was dispelled with this data, and it just showed that those examples that may have happened early on in the introduction of multiple programs had received significant attention from local programs to stop that from happening. I'll let Christy take over.
Okay. So MCV again was defined earlier. It's maternal infant. Next slide. Thanks. maternal, infant, and early childhood home visiting program. This is a federal grant that has several components that are requirements of it, and Oregon took a two-prong approach with this grant. The first one is implementing existing evidence-based home visiting services in communities. The communities that are listed here are where we went ahead and implemented that, and this was through an RFP process that was based on that needs assessment that identified which communities would be eligible to apply for those funds. So I'm not going to name all those. You can see them here and what those programs are: Healthy Families America, Early Head Start, and Nurse Family Partnership in those 8 counties that are listed here. And we have 11 implementing sites. And then the second component of this was our home visiting system development, that we really wanted to take it to the next level and expand on that very early conversation from fall of 2009 that Terry mentioned, and really figure out how do we come together more as a system for home visiting. As the legislature, didn't really want us coming as individual programs, we needed to come together as a system and figure out the best way to provide these services, with home visiting being a vehicle in which to do that. And so we pulled together that design team that Terry talked about. And on the next slide, you'll see this document. It's also a handout. It's in your packets and was out on the table for you to take with you. And this is a draft. We're still working on this, and one of those pieces we're working on is the outcomes component, which, as you were just having your discussion, is very parallel to the work that we're doing. The outcomes. We can certainly share our work, absolutely. So we have a great cross-representation that has been meeting for a couple years in developing. The first round of it was based on the federal benchmarks, and there were 35 constructs, and these 6 benchmark areas under which there are 35 constructs that we had to develop measures for and figure out how we were going to respond to that for those 8 counties. And then what we're doing now is we have a current work group that took that work to the next level and are looking more at a system level, and what is it that we want as a statewide home visiting system to be measuring and those outcomes. So we have a work group that's continuing to work on that. The other piece that's on here, if I start over at the left-hand side, is one of the major components that came out. I think when we originally started this conversation, we were thinking that we were looking at a centralized intake process, and we quickly learned through our conversations with local communities at being at this design team that it was that the no wrong door approach was going to be more successful, and that we needed to meet families where they're at. And so that's kind of the first piece, is this intake, the referral. We have the family support managers listed here. We didn't exactly know what that was, but we knew it was in legislation and that we would be learning more about that function and what that looks like. So this is where we, at that time, really see this fitting in and continue to see that as we're learning more about the ELC process. And that moves us into the home visiting entry process. We had a work group that met and developed a home visiting entry questionnaire. It was, again, cross programs. We had about 8 different home visiting programs meeting together to develop an initial questionnaire that they're just in the next week or so beginning to pilot in just a couple communities to see what we might have missed in that first round. So we start using this with some families. And then our goal in the other work group that is meeting on a regular basis is working on a statewide home visiting data system. That is part of the federal grant, that we have a home visiting system. My understanding is that was also when you adopted your data report in May. That was one of the components in there, was the home visiting module for that piece. So they're continuing that cross work. We have representation on both the work group from ELC and the data team that's been working on our system to make sure that we're aligning and connecting dots and not going in opposite directions. So that's this document, and the version that you have down in the bottom right-hand corner has the website link again for that needs assessment. Since this is the handout you have today, it's not really related to this document. It's just to give you that link so you could get to that needs assessment data. That website also has all of the webinars that we've recorded and provided information throughout the system. And I believe this document is also available there, as well as the guiding principles that this group came up with through that larger system design team. So the next slide, I've already touched on each of these work groups. These are the design team identified focus areas for this current year. they tasked these work groups to convene and start working on the major areas of the entry questionnaire. That group has completed their work, and now we're in a pilot phase with that. And the shared outcomes development, the larger group defined 3 major areas that they wanted to come up with outcomes for. Those were child development and school readiness, child physical and mental behavioral health, and parent-child relationships. The outcomes work group spent a lot of time noodling through the parent-child relationships and ended up coming up with a recommendation that we'll be taking back to the larger group to look at that for the time being under family well-being and protective factors. And they're looking at using that protective factors survey, which is a pre and post survey to measure that piece as an initial starting point for an outcome to measure this particular domain. Also looking at medical home, I know that was parallel with something I heard here earlier, and screening using the Ages and Stages questionnaire. Looking also at referral and linkages, that's a major component of the McV grant, as well as what we think the work of the ELC and the work of our system. We want to improve systems and coordination and that linkage, so we want to be able to measure that referral and linkage component. And this group is continuing to meet, and our next step is really to look at the system level outcomes and try and figure out how is it that we measure the work of this system, a whole visiting system, and what does that look like. So we're still continuing to meet monthly and continue to work forward with those pieces. And as I mentioned, the data system is also meeting. The development team is meeting every week, and then there's several of us that join them every other week to kind of make sure that the program piece is included and we understand what's moving forward with that. This last slide is talking about next steps that we have coming up. Looking at our ongoing implementation of those 13 local, it's 11 implementing sites with the local home visiting for Healthy Families America, Early Head Start, and Nurse Family Partnership, and then really looking more broadly at the system level framework and how we can start implementing that in local communities. And we want to continue the alignment efforts with the ELC and the CCOs, and we're still kind of figuring out what that looks like. And there is a possibility for applying for an expansion grant through these McPhee dollars in the spring. Our experience has been that you usually have about a 30-day turnaround, so there's just been some initial conversations about what might we look at as a state to and an expansion of home visiting and what are the opportunities there. And the group is hoping to do a home visiting conference in September. So we have actually in the room with us, Lori Grubstead is here. She's our federal grants manager for the McPhee grant and also the Early Childhood Comprehensive Systems grant through the federal government. Nikisha Knight-Coyle is the state home visiting coordinator through McPhee, and Sandra Potter-Marcourt is over there as well, who is our Early Childhood Comprehensive Systems coordinator, and all of these people can answer any questions.
Thank you. Questions or comments from the council?
Now, this isn't important, I guess, but when we got the grant, it's just confusing to me. Did we build 11 new programs? Is that?
Oh, no. Thank you for asking for clarification.
When you said local new programs, what were you referring to?
Okay, I apologize if I said new. So what we did with the first, there was more than one grant. There was actually 3 different grant opportunities here that all tied together. So with the first one, formula grant, which means Oregon just received an allocation, we added slots. We don't call them slots, but we added capacity for Healthy Families America in Malheur, Tillamook, and Multnomah counties. And we added additional slots for Early Head Start in Multnomah County. And we did actually create a new Early Head Start in Malheur County that they did not have that capacity at the time. And then we received a competitive grant, and it was a development grant. And with that one, it was for development. And so we specifically wanted to bring Nurse Family Partnership in a stronger capacity to Oregon. At the time, it was only in Multnomah County. So with that particular grant, it did add new Nurse Family Partnership sites to 4 communities.
I have a quick question. How long does the needs assessment, do you have to administer? You're looking at doing that with your families, right? The entrance that you're doing with all families when you do a home visit.
Oh, that intake questionnaire that they developed?
Yeah, I just went to
That's okay.
That's a great question that we can put in part of our pilot project. Based on having looked at it in the initial, my proxy using what we use for Healthy Families America, my guess is 5 to 8 minutes.
And the reason I was asking is we're also looking at the timing in terms of kindergarten assessment, that it takes 16 to 20 minutes per child to look at that. So as we started doing some of those. Okay.
Other questions from the council? I have a comment, which is that, it was, as I was listening to you, just the multiple interfaces just kept coming up. I think Terry mentioned it, and you mentioned it too, Christy. And so I think this council will look forward to having the home visiting system as part of the work that we do, and really harnessing the good work that you've done, whether it's on the screening or we can call it something different, in the intake and entry piece or the outcomes piece or whatever. I think we're really looking forward to having you as part of our work and really learning and incorporating that. So thank you.
And I think the group has been really conscious of trying to align with ELC. Very early on, we brought Duke to the meeting and said, do we stop? And he said, absolutely not. You guys need to move forward, and this is the kind of work. So I think we've been very conscious of trying to make sure that the work is aligned.
Thank you. We really appreciate that.
I think you just brought up a good point when you talked about the screening, and the word that we were using was home visiting entry questionnaire, and that it's confusing to understand. Are we talking about an intake screen, kind of that eligibility risk assessment, or are we talking child development screening? And so that's where even when you were talking about the outcomes, I'm writing down, are we talking, which kind of screening are we talking about? So
we have a lot of work to do there, because obviously, our charge, statutorily and otherwise, is to try to have that screening in terms of early identification screening, right, occur at the earliest points possible and occur embedded in the health system and embedded in child care settings. And so, we're going to have to figure out how all of this meshes. And just appreciate the efforts that you've made so far to try to keep things headed in the same direction.
Can we just ask one more clarifying? It's just not clear to me. Is the Affordable Care Act actually got a funding stream for home visiting? Is it a source of ongoing dollars? So you increased capacity and built some new programs where they were needed with Affordable Care Act dollars. Is that a new funding stream for home visiting on an ongoing basis?
it's up for reauthorization in 2015, so it was a 5-year allocation. But Lori can answer that better.
Yeah, it's just not clear. Is this an ongoing?
Is one of the largest maternal child health investments, new investments, in over a decade. It's $1.5 billion over 5 years. It is, as Christy said, up for reauthorization in 2015. And there's a lot of people working towards that effort now. And I must commend both the home visiting program in Oregon and the Early Learning Council, because the federal legislation requires that states build on existing efforts and leverage what's there and bring early learning systems together with home visiting. Don't create another home visiting program silo. Recognize that families have needs on multiple ends of a continuum, and how you build that together inside a larger early childhood system. And I would commend you listening to your discussions this morning and your data connections that you just mentioned, that the 5 required benchmarks for home visiting align with every one of your mandates and are required with the money in this grant, which is a large investment, to create data systems and the data to provide the information for you to know what you've done in some of those areas, including economic self-sufficiency and community referral sources, as well as children's health and school readiness. So there's huge opportunities for leveraging the money that's coming to home visiting to help you meet your outcomes as well.
So is it accurate to say that the passage of the Affordable Care Act did add a funding stream, $1.5 billion, as a funding stream for both system development and program capacity
dedicated to early childhood, 1.5 billion dedicated to home visiting in the Affordable Care Act over these 5 years, including establishing that inside an early childhood system.
Okay, thank you.
Is there a possibility to use a different word to kind of come with the objections to screening? I don't like it in airports, so, you know.
It's because you always get stopped.
Yeah, exactly.
Suspicious.
But you know, we heard from Curry County this morning about how Terry, I know you probably get that too. We all do in some segment of the community. Is there another? How do you turn that into a positive?
So what the home visiting group did is that intake screen, if you want, it's not really a screen. They worked really hard to come up with a different name, and they're calling it a home visiting entry tool or home visiting entry questionnaire. And that home visiting entry questionnaire, that was like hours, I think, to come up with that name because of what we did not want to call it.
Yeah.
So, yeah.
And it was really designed to capture high level criteria.
Right.
Staying away from eligibility.
Yeah.
Can I just add to David's comment is, I think it's a really good point, and I think as we work on our communication, this subject we need to address. But I would say that because the topic of screenings crosses over so many systems, and each one of those systems uses different terminology, it's not easy for us as a council to just pick a new name. I think we need to have language that we all understand what exactly it means, what it doesn't mean, and how to connect those conversations across many systems. So I appreciate the importance of communicating, particularly making it feel like a positive and not negative. But I still think there's a lot of connectivity that needs to happen.
A good example in my area is 2 hospitals 20 miles apart. One has 30% communication with new babies, and it's very negative to be contacted in one area, and the other one's 100%, and they invite the come. And so it's all how you use a spin, but it's how you present it and the value of it. So that's we need to keep that language going because we want to hold collective.
Right. Well, thank you very much. We really appreciate it.
Thank you.
All right, so council members, here's what we're going to do. We have an hour left in the meeting. We are going to take a very short break. And now I have an awkward announcement to make. We have working lunch for council members. We are not able to provide lunch for everybody, so I apologize. It's going to be a little rude. We're going to go get our lunch. We're going to come back. We have an hour, and we're going to work through the rest of our agenda. We have one action item. The rest is information. So we're going to grab our lunch. We're going to come back. Hopefully we can do it in 10 or 15 minutes. While we do that, I would ask that if you want to sign up for public testimony and have not already done so, please do that. I'll grab the list probably about 12:15 or have Seth do that, and that'll be our last call for public testimony sign up. And then when we come back, we're going to get started with a series of information items that starts with an update about the hubs, and then our one action item, which is the charter for the Joint Health Policy Committee, and then director's report and worker efforts. All right, so we will reconvene sometime between 10 and 15 after 12. Thank you.
Okay, so if I don't everybody in the day, I'll email Aaron and try and get you Have a good Thanksgiving. Yeah.
I don't want to stay with
That's the public testimony.
Sit up there with the and so with the January
I guess first or
Yeah, it's right there.
Hi. Could I use? Oh, yeah, sorry. That's okay. I'm here for Kathy Cooley. Oh, okay. She's pretty far out. And this is all you have? For public testimony. And when does that? That starts after everything else. Right, so if we have 10 minutes, then everybody gets 10 minutes. If we have 20 minutes, everybody gets 2 minutes. I'll just put myself at the end and you might not have time.
These chairs were comfortable, but they're not
This is just a speaking, so that's going to get the other one out.
This one puts a microphone in front of you.
Yeah, that's all right. Yeah, thank you. It didn't take you here, but.
I'm very excited. Where? Yeah, and this is very fantastic. And
I think that's going to, that was really important to me. It's a policy board here to say this elimination. So I think that's really great. Well, it's really nice to meet you. Yes, I'd be happy to.
So do you want to do it? Would that be the last one?
Absolutely. It'll be a good one. Work in progress. We're all lost.
I forgot to
So Sandra and Jasmine, they were, the other night I came in and talked about the configuration, and they were standing out in the hall going like this, and so I walked outside, and then just before the meeting started, this morning, Jared was standing, he was gorgeous. Yeah. He was wonderful. Wonderful.
This is one that struggled.
Absolutely.
Going to
Do anything. He's on the church here. Absolutely, absolutely, and he loved
He's lost weight. I see postings all the time. Going here, activities that he's I think it's a good family. She was moving to. Did you have to do her spot? Okay, is it still right here? I want to say that. Yeah, yes, I have.
So many wonderful people are touched on it. You think I think it's right? Yeah, I told them really.
I'm not sure if everybody did.
Wonderful. There's
There are people that are in comments when they have call-in lines, so they're welcome to sit on that. That's wonderful. I know it.
I'm thinking, I was here and I was thinking,
I totally
so much better about this than I am about the ESD.
Oh, good. Oh, shoot.
No, I really am. Oh, goodness. And I think it made me rejuvenate us. And we've gotten
Movement forward.
I'm just telling you.
Yeah.
Because these organizations have not come together before. I was because I just left for the band and
But you know, our
well, and you know, we really want to. Oh, we wrote a grant called Innovative Approaches to Literacy. We didn't get the grant, but actually it talks about early literacy from babies on up, and but there's measurements.
Absolutely.
So I'd love to have you look at that. I mean, I don't know what there is out there, but it's like a $500,000 grant. So it's a huge plan, and we implemented if we only had a part of it. I think I have enough to fund some small pieces of it, like the babies. It's called Teens to Tots, with teenagers reading to little ones. It's showing the parents how to read. In our library, or the public library, or wherever you like us, or here at the Family Center.
You bet.
Yeah. I will. Yeah.
That'd be wonderful.
And then Thornton is the big
Oh,
push
maybe
behind
it's one of
it.
my
Okay.
So awesome. Great teacher.
And Betty Christians, and it was a combination of the two of them. And then they went to chat. Yes. Oh, yeah. I am so lucky. Oh, I'm very lucky. That was great. That was just, but they're like, just passionate. Okay. Well, thank you. That's what I hear. I know Sonia was saying she did a second and I did. No, but Bruce Schellers, she's the leader of this year. He's the chair. And I guess these are amazing. Absolutely. Are you going to eat something?
I'm not. I actually had my cholesterol.
No medication. That's
That's the first time. Yeah. Thanks for the issues. So we're trying to get it down in 6 months. It's going to be very specific. It's free exercise, diet. No stress, though. Yes, no stress.
Is that what that is?
That's not happening.
Why don't we all have that?
Because I got actually that's kind of free. Yeah. What?
Did you hear that?
My family.
Oh, I've just been really always.
Well, have you gotten it for the last meeting?
Yeah.
Which is what
Oh, yeah. I'm going to go anyhow, right?
It's not me, it's my parents' phone.
Darn parents. They were 85 years old.
My husband's grandpa is 96.
Yes.
Smoked a pack of cigarettes, non-filter a day until he was like in his 80s. I don't know, had bacon and eggs, but I don't have to go to eat and think about it. None of those things.
It's not you.
Turkey bacon is what I can do. Fake eggs.
Yeah.
I love my fake eggs. They're nice.
They do make a great omelet. Oh, the problem is No, I was just talking to Kathy lost it. That's one thing. After her daughter was parent council, but I've always been active. She just when she said to me, I'm going to start how did that happen? And how did that? So your goods probably high because of that. Yeah, but it would have been wonderful. Put me up over the edge. Oh, we have a parent on the child. That was in it, right?
It is so hard.
It drove from Umatilla
That's a huge expense for a low-income parent.
Oh, absolutely. Well, that's one thing with the CCOs and the community advisory councils. We're building in stipends so that families can participate. Because, if there is, if you want to.
There's evidence. There's evidence.
I would hope not,
Yeah.
because we're redoing
There's
it.
a group called, what's their name?
Sorry, I'm now going to get over
They're out of Maryland. Anyway, it has to do with families.
You got a street address on here too?
And they actually have documentation, and they gotta do those things.
There you go.
I hope too late. You don't have to. But you want to do a lot more. Or at least somebody could take it to their shop.
And I'm out.
Absolutely, yeah.
Yeah.
Or at least have to take it to their nonprofit.
Which one's coming first?
Pretty
So
exciting.
you just said 46 divided by, the last 12. Is that what you did? I don't know. I mean, that's what I'm So 46 times 7. Yeah, and then there's breakfast this morning, they included paper. Yes, it is. This is the note taker here. I don't take notes.
We go to our daughter's house, which is really interesting.
Your mics are off, so just let me know when you're ready to go.
We're ready just about. So actually, we're all here.
Dada,
Okay.
Jim.
So go ahead and turn us on and we'll get started.
Hardly know anybody.
No, I'm not. But I've had really trying to straight.
Is she listening to Crystal?
But they were.
Okay. We are gonna get started. So if I can have them just make their way to their seats, we're gonna go ahead and get started.
Writer in residence at the court.
Okay, council members, we're going to jigger the agenda just a little bit to allow, to accommodate Krista getting her lunch. And the next item on our agenda, so we're going to skip over item number 6. We're going to move to agenda item number 7, which is our action item for this afternoon. And this is the adoption of the charter for the long-awaited joint committee with the Oregon Health Policy Board. So Dana.
Great, thank you. So I wanted to present today a draft charter, and as Chair Curtis mentioned, we're looking for action on this. Pam spoke with the Health Policy Board about a year ago and identified a lot of opportunities for coordination. I think there's been many people thinking about this major health system transformation and now a real huge focus on education transformation and how are we not going to create two large silos, but how are they interconnected and coordinated. So out of those conversations grew the plan for a joint subcommittee between the Early Learning Council and the Health Policy Board. We finally have started moving that process forward. We had a planning meeting with the chairs of those committees and boards and staff leadership, and we are hoping to move forward our first meeting of the subcommittee in the following month. So I will point you just to this charter, and I'll briefly give you an overview. Of course, the authority, you certainly are familiar with that of the Early Learning Council, but for future reading, if you're interested on the origins and role of the Health Policy Board, I've outlined it there. The previously determined membership of the subcommittee includes, of course, the executive sponsorship as listed here, which is Jada Rupley, I say her last name wrong all the time, and Tina, who is my boss at OHA. I will be staffing this subcommittee with the support of Jennifer Gilbert as well, and then you see our both ELC and Health Policy Board subcommittee members. I would mention that I presented this charter to the Health Policy Board on Tuesday. They approved the charter with one recommended addition, that we add representation from the Department of Human Services to the subcommittee in either a staff role or potentially an ex officio role, so we will be moving that recommendation forward. In terms of scope, the subcommittee, as listed, is responsible for developing strategies, a framework, and a timeline for alignment and or integration between our health system transformation and our early learning system transformation. Some of the work intended is to develop some guiding principles or adopt guiding principles that will really be based on founding principles of both of those bodies, but including things that are unique to this subcommittee, such as maximization of existing resources, avoiding duplication, and certainly coordination. I've identified some key areas of focus for the subcommittee. It's not going to be the exclusive focus, and we will be working on identifying what those are, but including screening, care coordination, discussion of data, and metrics. And also looking at outcomes and accountability, particularly around what does it mean for health and early learning system to jointly be responsible for kindergarten readiness. So the major deliverables, as you see here, include a set of guiding deliverables for this subcommittee, again based off the founding documents of our two groups, assessment of key areas for potential alignment, developing a straw person proposal, and identifying a timeline for how we might look at shared kindergarten readiness as a shared outcome. I will just point you down to the schedule. Our plan right now is to meet bi-monthly. Our intent is that we will have these deliverables completed by December of 2013, with certainly an understanding that that timeline may be adjusted as needs arise. So I really look for your feedback, and ultimately I'm hoping to move this forward after your approval.
Comments or questions from the council? So I would actually suggest, council members, that we make one suggested addition to this charter, and that is to make explicit a deliverable or a charge around screening, and that would include some of the screening items that are on our timeline that we looked at earlier that haven't had a venue to address them. Screening metrics, aligning with payment, process to evaluate and modify our screening process, and addressing family well-being, all as part of that. The way I would see that happening is, as you might remember, we asked also our Child Development Subcommittee chaired by Bobby to make some recommendations about how implementation would occur in child care settings, and it would make sense to me that those recommendations not just come to us as a council, but also be forwarded to this committee so that this committee could look at overarching protocols, training, workforce development as well, and bring that back in a cohesive way to us. So that would be my recommended addition.
And along that same line, making sure that when that implementation of screening happens, there's a mechanism to make sure it gets entered into whatever data system. I've just seen the whole immunization thing where private providers don't enter into the state system and then things flow between systems and you can't get access. So somewhere there needs to be some sort of coordination so that, yes, the screening happens, but they're also participating in the data so that we're capturing the work that's being done along the line.
Great. Other comments? Is there any objection to adding the piece that I suggested that we add as a recommendation?
No.
Okay. So with that, is there a motion to approve the charter before us with that, those set of screening implementation additions?
So moved.
Is there a second?
Second.
Is there further discussion?
Do we also need to recommend the DHS staffing addition?
I would suggest that we approve the charter as amended by the policy board. Is that acceptable for your motion? All right, further conversation or discussion? Is there anyone then opposed to approving the charter as amended by the health policy board and with the additional recommendations relating to screening implementation? Any objection? Great, so approved. Thank you very much. All right, let me make and we'll have Krista come forward to talk about the update from the hub group. And as that's happening, I let me just make a couple of logistical announcements for the rest of the agenda. So now that we all have our lunch, I now can invite you in another awkward sort of announcement. To please, if you're one of the guests with us, there's plenty of food. And we would invite you to grab some lunch. It's in room G, which I neglected to announce to the council members, so they were wandering around, so I apologize. But it's out the door and to the right to room G. Please help yourself to some lunch. And then we have a large contingent of folks signed up for public testimony. So just in advance warning that I'm anticipating you're going to get about a minute if everybody actually follows through. So if you can try to focus your remarks, and we would welcome any handouts or any of that. Just maybe we'll get more than that. We'll see how quickly we go through the rest of the agenda, but it's probably not going to be more than 2 minutes. So if people could just really focus and think about that, we would appreciate it. All right. Kristen.
Chair Curtis, members of the council, thank you for the opportunity to update you on the work of the work group. I will be providing just a high flyover relating to our charge, and then I would invite additional context from the members of the work group who are here or on the phone. We have met a total of 7 times, 2 collectively and 5 in the iterative process between proposers and refiners. To respond to the charge from this group. We have 1 refiner meeting at the end of this month, and we also have a joint meeting on December 19. At the end of that meeting, we hope to begin the process of culminating all of our work and preparing it for a report to this council in the new year. We have also been engaged in a number of input sessions across the state. Last night was a very good example of what those look like. We've completed 12 of them. Approximately, there might be 1 or 2 that I forgot about, but about 12 of them already in a variety of different settings and locations from Eastern Oregon all the way to John Day. I've seen a lot of Oregon. It's been a fun opportunity. To different organizations. John and I were just at the AOC conference where we conducted another input opportunity for the Health and Human Services Committee. We have about 6 more of those input sessions scheduled to make sure that we're reaching all of the appropriate groups who have interest and who are stakeholders. Some major themes that have emerged from those input sessions are really requests that we continue to build on strengths that exist within communities, and that, I'm grabbing my notes, that we really work to create usable and accessible systems that maintain and improve on the current standards in counties for a better coordination of services. Repeatedly, we have heard from all communities that there's a very significant interest in making things better for families through increased coordination for services, and that's been very affirming to our work. The concerns that we have heard have primarily been around what happens if that's not in place. We don't want to have any kind of disruption of service. We don't want unintended consequences from something new that doesn't take into consideration the variety of specific or community norms that are a part of the communities that we visited. And so the themes have kind of followed out of there. In terms of messages to the council, there have been, and to the work group, there have been a variety of conversations, but really it's just to pay attention to those potential unintended consequences and really be thoughtful. Flexibility for communities to really do what they know how to do best has been another theme that they've sent back. And so given the conversations we heard last night at the community forum and the reports today, those seem to be fairly in alignment with a lot of the other messages that and the work that's actually going on. And so again, we consider that to be an affirmation of our work. Beyond that, I will hold the update of the work group and its status for the actual final report that comes in, and be open to the context of our work group members who are present and any other questions that the council might have.
Let's see first if members of the Hub work group have anything to add.
I think Krista did a good job of describing where we're at. We're still got a couple of final conversations before we really know what our recommendations will be.
Okay, and we contributed to that, I think, today by having this helpful conversation. So that's good. I think Lynn has dropped off. Is there anybody else from the work group who wants to make further comment, and then we'll open it for questions? Okay, questions or comments from council members?
Is there a list of where the listening sessions are going to be held, the 6 remaining, and where they have been, somewhere we can access that?
Yeah, I'll make sure that they get on the website. Some of them are still in the process, and they have been in the process of kind of getting firmed up, but I'll make sure that they get there.
Great. Other comments or questions?
Krista, have any of the tribes been asked or spoken to about any of the piece?
Yes, thank you. I've actually met with NAYA on several occasions to invite their participation, and we're still talking to them about how that might best be supported.
The tribes are actually not represented by NAYA, so it would be my recommendation to go to maybe one venue that all the tribes would be at, would be like a government to government, and go over it with them, because it's just like myself. I can only represent Grand Lawn, but I'm completely different than Umatilla, and just a suggestion.
Can I follow up with you on that later?
Absolutely.
Thank you.
Great, thank you. Any other comments or questions from the council? Okay, great. Thank you very much. And this is a monumental task. Thanks to all of you who are part of this work group effort. We really appreciate it. Okay, we're going to go to the director's report, and just again, an announcement. We now are able to offer and invite you to participate in lunch. So if you're so inclined, it's out the door to the right in room G. And we'll go to public comment in just a few minutes.
I'm going to make mine really quick in the interest of time. I will hear specifically from Heidi on the race to the top, and we wanted to let you know that the team actually has been working on a revision. They had a phone call on Tuesday, and actually Kara Waddell is at home finishing up the department request to send out today. Starts in January. You heard from Krista. You also heard from Christy, so you can see staff are working hard and fast to be able to look at those. The hubs, I want to say that we've had several council members sitting on that, and thank you very much for that. That's been a very intensive process, not only including listening to all the communities around the state, but also in the fact that they've had meetings twice a month to be able to do that. I have a book that I gave each one of you, and one of the things that you'll be amazed is that it's probably going to generate lots of conversation, and the fact that we hear many things about poverty. And in this book that they're looking at some of the new things in terms of it really isn't as much about poverty, but it's about grit, and it's about resiliency, and it's about a number of things that make children successful or unsuccessful. And it's starting to change conversations in some of the places that we are in terms of not so much poverty driven in terms of success, but to look at what we have in terms of characteristics for kids. It's really a cool book, you guys, and so I really wanted you to be able to see that. Jim, you experienced that in a meeting just the other day where somebody had looked at that. And I want to say thank you to the council members. Not only did you do the travel for this time, but each and every one of you have been involved in your community forums. You've been involved with work groups, and that kind of volunteer work is what's going to make us successful. And then I have made some progress on my visits. I've been able to have visits with Dick, with Nell, with Vicki, Marlene, Dana, and I've spent a lot of time with Jim and Lynn and Charles in those work groups. So we've become the best of friends. Thank you. You need a friend?
Well, I want to say an incredible thank you to Jada. She indicated earlier, this is her second meeting. The last meeting that we had was in the Dell. She started, a week or something right before that. And so this is really the first meeting where she's had any sort of time on the water with the council. And she has just hit the ground running. we whispered back and forth when the timeline got shown up there that I didn't actually show her that timeline before she took the job, and maybe that was a good strategy on our part. But it's been a whirlwind, not just to sort of catch up to where we have been really over the last 2 years. This started when the governor was running to be governor again. So just sort of catching up to where we've started, but coming into a new state to do that. And she has done a remarkable job. I think we're very fortunate to have her here. So thank you.
I love it. Except for this timeline.
All right. So we're going to move on to work group updates. Oh, I'm sorry. I was remiss. Council members, questions for John? Anyone?
I mean, the rest of you that I haven't seen, you're on my list to do.
All right. Okay, thank you. So work group updates. You have a summary in your packet of each of these. I'm going to have Heidi do a very brief work update on Race to the Top, and then we'll see what sort of questions you might have.
Okay, great. Thank you, Chair Curtis. Jada gave us a brief update on where we're at. We're very, very excited to be one of the 5 states invited to apply for round 2. We understand that this is essentially a negotiation between the feds on our original application and taking the original application that we applied for $40 million down to $20 million. So we had to scale back what we proposed to do, but nonetheless, we are still in good position to bring in to Oregon $20 million over the next 4 years for early childhood. Where those funds will go, there's 6 focus areas listed on your one-page document here, but I just want to call out that what it will do is further some of the council priorities that have already been prioritized and were on the timeline we just reviewed. So for example, there's some funding in there to implement statewide the tiered quality rating and improvement system. Another thing that is in there is a little bit of funding. It's not a lot, but it's a little bit so that we can implement screening statewide. We can move from where we've been to implementation. There's also a little bit of funding to implement the kindergarten readiness assessment statewide. And then another area that's not really called out here is that we did put in some funding to further the recommendations that were in the data report that the council adopted in May. So as we have looked at this application, we have been the council priorities were front and center as we applied for towards the requirements that the feds had of us. So next steps is that, as Jada noted, we are in revisions as we speak. We anticipate to be informed. An announcement will come mid-December, and I understand that the governor's office would like to do some kind of a press announcement with that, and then funds would be dispersed early January. So it's a fast timeline. We're moving quick, and we're very, very fortunate to be in this position.
And we'll be inviting all council members to participate.
Great. So while you thought we didn't have a meeting in December, we're going to have a party. All right, questions about the Race to the Top application? Okay, yay. Great, would you just stay there for a second,
Yes.
Heidi? Let's just jump down. You had a report in your packet on TQRIS. There we go. Were there any questions related to that Heidi can answer while she's here?
Oscar, my name's going to be a new name.
And actually, that is targeted, I think, December 1st. In anticipation, so when we talk about Race to the Top, we have a name that resonates with people about TQRIS, and we stop calling it TQRIS. That's our plan.
So any questions about that rating system? All right, very good, thank you. And a brief update on Child Care and Early Learning Subcommittee. This is our one standing subcommittee at the moment. Maybe that'll change in January. The others are work groups, time limited, but this is our ongoing committee. Bobby, do you want to?
We have 3 priority areas. The first one is the one we got at last meeting on screening, and we have a small work group that's working fast to come with those recommendations. So their focus is to come back to our work group with a set of recommendations on how, what screening is appropriate to be done by the early learning and development workforce, and what would it take for them to be able to do it in building off of the report that we accepted. And the second one is working on integration. What's the vision for an integrated system of early childhood learning programs? We say it all the time. We've been working toward it for a very long time. And this group is going to put some meat on the bones, I guess, is the way to address it. And the third group is developing recommendations to what's in 4165 as a requirement for the council, which is a definition of quality, affordable childcare. And so these three groups are working right now, and will report to our work group on November 29th. Our anticipation is that they will keep working on a pretty tight timeline, all three of the work groups.
Questions for Bobby? Okay, great. Thank you very much. Great. All right, we are going to move to public testimony. So here's the test, right? There are 11 folks signed up for public testimony. We have 15 minutes. That roughly is a minute and a half. So I'm going to play timekeeper. I'm going to call you up 3 at a time since we have 3 chairs, just in the interest of trying to make things go quickly. And what I'll do is just give you like a 1-minute warning, and then I'll ask you to stop at a minute and a half. And I apologize, but that's the time that we have left. And I apologize in advance if I butchered anybody's name. So let's see, the first 3 on the list are Michelle, Hannah, Annette, and I can't read your last name from public health, sorry, and Valerie Rose from DHS. Come on up, and I'm going to use my little stopwatch here.
Valerie's not here.
I'm sorry?
Valerie is not.
Valerie is not here. All right. How about Kathy Cooley then? All right, so we'll have Michelle go first.
Okay, my name is Michelle Hanna. I'm a home visitor to the Healthy Start family, or Healthy Start and Healthy Families in Curry County. And I kind of know that this doesn't fit today, it fit yesterday, but I'm going to throw it out there anyway. Every day I visit first-time parents in my communities, and I teach brain development to parents, and I find it really exciting. I find it exciting because they're learning things that I just learned, that are new, that are the newest possible child development that they could possibly get. And so, these uneducated, sometimes uneducated parents are getting pieces from college and putting them into their homes. One of the things that I practice well, and I should use it right now, are breathing exercises. I'm a little nervous.
And to make you more nervous.
Yeah,
about 30 seconds left.
Yeah,
Sorry.
Okay. So I'm going to get to the gist of it, I guess. One of the moms that I work with, when I told her I was coming to this meeting, she said, "Wow, I really want to give you a testimonial. I want to be here." And she has twins. I told her, "Don't come. You're going to be sitting here all day." And I'm glad she didn't come. But she wanted to throw this out. She said that she'd like to give me a quote. And she said she is a better parent to her children because of the choices and goals that she's made with help from the Healthy Start program. This mom said it would have been easy not to look at her own upbringing, to not make those hard decisions, to not look at her parenting skills and do things like her parents, and that Healthy Start provided a forum for those conversations and for the acknowledgement of where she stood and where she's going. And that's the gist of our program. It's community building.
Great, thank you very much. Appreciate it. Okay.
I'm Annette Kleinfelter, and I am the Manager of Planning and Development for Curry County Public Health. And I really want to acknowledge the direction that you're moving in terms of aligning with the Oregon Health Policy Board. when I came to public health about a year ago, we had a .2 designated FTE, home visiting nurse, managing our cocoon program as well as our Baby's First program, in addition to doing communicable disease, in addition to running our school-based health center. And we were only serving about 4 families. It took an investment from Maripa, which is now All Care, our CCO, as well as the Ford Family Foundation, which if Christy's still here, thank you, Christy, and the Gordon Elwood Foundation, to generate enough funds to be able to hire someone full-time to specifically do the maternal case management. And so I really, in places like Curry, these programs don't pay for themselves, and it requires some very, very close type partnerships with coordinated care organizations and local foundations to help them understand, as you would say, Mr. Whitnell, what the return on the investment is. And so it wasn't hard for us to go to All Care and say, $1 million baby is going to cost you a lot of money. And so writing a $50,000 check to leverage a Ford gift was a no-brainer for them. So I do think that you're moving in the right direction. This is very much what you're talking about are the social determinants of health. And so when we can get moms in prenatally, build those relationships as soon as they come into our public health department, we can retain them. And we can retain them from 0 to 5. So thank you.
Thank you very much. Good job, guys. All right. Kathy.
I'm Kathy Cooley. I'm the Nursing Services Manager for Coos County Public Health and the Program Manager for Coos County Healthy Start Healthy Families. And just so you know, Myrna's been gracious enough to yield her time to me.
Oh,
because I already chopped this as much as I could. So research tells us that the first 3 years, including the prenatal period, are critical to the way a child's brain gets wired. The years represent a crucial period when massive neurodevelopment is occurring. We know that both good and bad experiences during these first years of life wire a child's brain to adapt and survive in that environment. Consequently, early childhood is the period of greatest vulnerability to maladaptive applications, but it is also the period of greatest opportunity for positive change in brain function and development that will directly affect a child's ability to be successful in school. Parents are our children's first and best teachers. Parents who are attentive and attuned caregivers provide experiences that help a child's brain develop well, whereas parents who are preoccupied with surviving, finding safe housing, money to pay for gas, addressing and coping with postpartum depression, adequate food, etc., have little time or energy to provide for the stimulating experiences that foster optimal brain development in their children. The importance of intervening early with families of disadvantaged children cannot be overemphasized. The Adverse Childhood Experiences Study, aka ACEs, gives weight to the importance of tending to the needs of our most vulnerable citizens, our infants and children. The impact of ACEs cannot be ignored as a matter of conscious choice. The chronic public health disaster of ACEs and their effects on children's developing brains are real. The cost of trying to repair and remediate these children is far greater than the cost of preventing these problems from occurring in the first place. Evidence-based home visiting programs such as Parents as Teachers, Healthy Families America, and Early Head Start help prevent these problems. They provide a high return on our investment. We all have a responsibility to assure that children have adequate nurturing and positive experiences. Indiana Association of Infant Toddler Mental Health summarizes this issue well. What happens in the first 3 years of life can lay the foundation for becoming a productive member of society, or it can lay the foundation for intergenerational cycles of abuse, neglect, violence, dysfunction, and mental illness. The success of our whole educational system can hinge on a child's first 3 years of life. Please invest in our society's future wisely.
Thank you very much.
Can I comment? I would just try to make it brief. I would just pitch from Dornbecker 1,000 days, what it does to the child on the conception for a female. 270 days from conception up to birth, and then for 2 years. If the female is in good health, it kicks. They have data to show this to me. He had reams of it. I can't think of the CEO that's up there now, the doctor, that great guy. Yes, okay. it's very well documented that it just alone, now I know you're talking about child development and everything, but just we haven't heard today anything about the prenatal care and then the female for afterwards. So maybe that's another return on investment that we should be talking about also, because they have the data that shows that just the child alone at age 6, if had this care of 1,000 days, conception 2 years is the launch. So I mean, something that we should look into is another return on investment, if you want to call it.
Yeah, no, it's vital. I mean, the studies show you it's like you have to be just right, really. You know, you can't be overweight, you can't be underweight. So, I mean, it's really paying really good attention. That's why the public health model of doing really good prenatal care, we've developed actually the funding supported a patient-centered primary care home specifically for moms and babies. And so we have alignment with all of our feeder hospitals, and so we're getting them as soon as they get pregnant so that we can do that good prenatal care.
What really sells in my mind is using the term behavioral economics. It's no different than you quit smoking, you put on your seatbelt, you blah, blah. So if you do this, you really do get less cost to your health system.
Absolutely.
But it needs to be sold in education so people will buy into it and will think, hey, that's the way it should be doing.
It's a good marketing opportunity for you all within CCO, so you can use
it is. Thank you very much, ladies. All right, next up, and again, I apologize, I think it's Lori Potts, Kathy Barber, and Cassie Windred. I defer.
Deferred. Good.
Got it. I'm just deferring. All right.
Here you go. Okay, first I'd like to thank you for this opportunity to visit and speak with us yesterday and today. And my name is Lori Potts. I'm the Childhood Education Director at Southwestern. I'm going to just read here. I took this position in 2000, brought with me a background of being a Head Start parent with my firstborn son, now 32, Head Start teacher, home visitor, Head Start teaching assistant, area manager, education specialist, education supervisor. And the experiences of all the families that I worked with, as well as of the teachers, administrators, and partners carried forward with me. What I quickly saw at the college at the Family Center was that there was an amazing untapped potential. And so we began. The Family Center was renamed as the Southwestern Community Partnership Family Center. It's a long name, but it represented a goal and the essence of what we've been working for more than a decade, community partnership for the benefit of our children. During this time period, I clearly saw that our best work for children came through our collaborations. Through collaborations, we've had opportunities to bring together social services, health, parent training and education, early childhood education with a strong focus on including family members in all that we do in early learning and literacy. And I recently wrote an article for our Care Connections Child Care Resource and Referral newsletter titled "It's the Season for Nurturing." And I also believe that it's a time or a season to reevaluate and gather in the best work and practices from all of our partners, agencies, service providers, early child education, public school districts, child care providers, businesses, faith-based communities, and the families that we've worked with and learned from. I believe it's a time to focus on what we have learned relating to brain development, early learning, early literacy, attachment, nurturing, standards, readiness, the importance of the early years, 0 to 3, and of course collaboration and recraft our work. I would respectfully request that as the Early Learning Council guides and directs this work, that attention will continue to come back to the core of what we know. Our best work comes through collaboration and relationship-based teaching, coaching, mentoring, and modeling, and that these activities need to be supported through home visiting, such as with Healthy Start, Family Support Connections, site-based training of parents as seen through our state's OPEC project, child care providers in all models, including family home child care, private preschools, such as the little ones with the enthusiastic teachers like in Bandon that we saw last night, Head Start, OPQ sites, and NAYC accredited sites such as EduCare program, and our communities at large. Why? So that community-wide support will increase on behalf of our young children, so that adults will understand and act upon what they know to support children in their development, so that all children will reach their potentials and capacities in readiness and development.
Thank you very much.
I would need 20 minutes to say much of anything, but I want to give one little example of something we found. When we created this this Nurturing Community Coalition, what happened was we found out that there was true magic in getting a bunch of excited, interested, capable people in a room and asking a question. What do you think in your world would make this a a more nurturing, growing, thriving community. And people kind of did little work meetings and conversations like you did last night. We worked at tables, and we had dentists and doctors and agency people and school people and the woman that lives next door, and it was just getting the community together. And I was thinking when you were talking about advancing the notion of school readiness in the state, what if conversations like that happened in every hub area, and what if hub areas were small enough so you really could have that conversation in your communities, and it was about what can each agency, person, business, whomever do in their sphere of influence to get kids ready for school. And I'm guessing the same kind of magical brainstorming and synergy would happen that we've seen here, because it's really been remarkable the kinds of things that have come up and what people are willing to do. And I guess that's all I want to say today.
Thank you so very much. All right, so our last person, we have Lisa DeSalvio, great. Okay, and Donna Leverage Campbell and Josephine Morrison.
Donna's not here.
Donna is not here. Okay.
I just wanted to agree with somebody I heard on the council talk about that. Poverty doesn't limit children's ability to learn. It impacts opportunity to opportunities and community resources. It mandates us to push to close achievement gaps. Those children and those families have to work harder to get ahead, not back off. If that's what needs to be successful. But it requires that when you folks make your decisions and things are considered, that you consider that equity is not always equal, and that in certain communities where you don't have those resources, you have to put that in consideration, and that rural communities are not I-5 communities. We don't have multiple opportunities and multiple people, and I got one therapist for children 0 to 5. We can't find a child psychiatrist that's going to come here and wants to work here. And those are considerations that need to be made, because we have to be able to pay somebody more to come here or do something. But please consider that in your plan and when you talk about that. I make no excuses for our community and the poverty. It is what it is, and we need to do what we do with what we got. But we need to be able to have the resources to do that. My question for you is, as a school district person, the kindergarten assessment, I'm always going to assume when I hear that's going to happen in kindergarten. But I'm curious to the reading at the end of first grade. At all of the discussions I've heard, I've never heard about an assessment coming in at the end of first grade or second grade. It's not in the conversations in the K-12 system. It's not in it when I talked about the assessment profile of what's going on with the development of the new assessments. Where's that plan to come in, and how is that going to work?
So I can answer that. So this council has 3 goals in statute, and they really start with that pivotal time of third grade and third grade reading and sort of walking that back, right? So you all know way better than we do, because of the experiences you have every day, that critical to that third grade reading is the ability to read in first grade. Critical to that is readiness to learn when you're into kindergarten, and critical to that is all the family issues that you've been talking with us about. So it was really a very logical approach that the governor and the legislature took to sort of marching back from that third grade. There is no current plan that I'm aware of anyway to institute a first grade reading assessment, but it's a rallying point, and it was also included as a mechanism for us to talk with the K-12 system about continuing the momentum past kindergarten.
Thank
you.
Must be my turn.
It's your turn. You get the last word.
Oh, good. I always like that. All right, so I'm Josephine Morrison. I've been a public health nurse for 10 years. I formerly was a speech and theater professor at this college. So I have the ability to look both at the educational needs as well as the in-home needs of our families. And I see a tragedy here. And the tragedy that I see is that we're screening, and everyone needs early childhood education. And who are we screening out, and who are we screening in? Everyone, when they're pregnant, that I've met is very excited about their baby, and they want more information, not only on delivery, but what do you do afterwards. I think there's a real window of opportunity there for OBGYNs and pediatricians to encourage and to possibly fund at the hospital level, where I also work as a childbirth educator, maybe classes if the hospitals can't come up with the funds either. So perhaps you could have core groups there at the hospital, and we could start that 0 to 1 month to 2 month developmental attachment process to avoid what we've talked about in the ACEs. The other thing I see is that I take the toys and the parents play parallel with their children. We're working with parents that maybe were not parented and they don't have an idea of how to parent. So are we screening the parent or are we screening the child? I think we have to look at the parents, because then we can help at the beginning before the life is birthed. So then when we look at the OHP status and we have parents with no medical coverage, how do we address their medical issues? Because the medical issues are preventing them from becoming the parent they want to be. And that, of course, goes back to the whole ACEs and how we raised ourselves, or if someone else raised us, that's what we're looking at. So if I could call upon the medical community to buy in along with the educators, and we could all get on the same page, and all families be encouraged to enter into early childhood education, because then everybody's going to come, and it's not a stigma. It's like, yeah, we all need this, and this is where we're moving. I think that's it. Thank you so much.
Thank you, Josephine. We have a committee we just started for that, right? All right, thank you so much. And thanks again to all of you for being such wonderful hosts and for opening your community and your hearts to us. We really appreciate it, and we've learned a lot, and we're looking forward to learning more. Council members, thoughts in closing for the meeting today?
Well, Pam, I think you read it last night, and so we thought we'd come to the coast here to be all rainy and gloomy, but it's fine. 2 beautiful days.
It has been.
And it's just been great to see everyone and everything they're doing.
Other thoughts in closing from council members?
Something we mentioned offline earlier, but I wanted to mention to the full council. When we've taken our show on the road, we've gone and seen what's happening in communities, and it tends to be rural. And I'm from rural, and I kind of know what rural does, but I don't know what urban does. And so as we're getting back on the I-5 corridor, it would be nice to have this experience along in the more urban and suburban areas as well, so that I feel well informed.
Thank you. And so to that point, we committed a year ago when we were in this death march to get a report out the door that once that was done, we were going to go out to communities, and that's where we were going to spend our time, and that's what we've done. And now the legislature's coming back to town, and so we're going to stick around close to Portland, Salem, maybe Eugene, until the legislature is done. We're going to be in regular conversation with them about the kinds of things that we've been talking with you about, and so we are going to be in the I-5 corridor for the next few meetings, and then hopefully we'll be back out again.
I think it should be noted that no one has a monopoly on poverty. Marion County is the #1 most poverty county in the state.
Well, I-5 is paid with coal.
That's baloney.
It's paid with baloney.
Yeah.
There you go.
You're losing control of your council.
All right. Yes.
I would add what Dick said. I work in Plaquemines County, which I believe has the fourth and the wealthiest people in the state. And we had a referral for early intervention from a child who lived in like Oswego. And that is one of the most wealthy communities in our state. And this was early in my career, I didn't really rush out to see this home because there were kids in Molalla place. Well, when I got to the home, it was one of the worst situations I'd ever seen. The child had autism, was 3 years old. The family had no food. I mean, it was just, we do make assumptions in some cases about where you live having a major impact on your resources. And it is sort of true, but there are children with needs everywhere.
Thank you, and hence all of our children. Yes. All right, thank you, everyone. Council members, our next official meeting is in January, but you'll be invited to what we anticipate will be a race to the top party in December. So stay tuned, and we will also, council members, be providing legislative updates during December when the legislature is in their session. All right, we are adjourned.